scheduled session for the Committee on Health and Human Services. We'll be hearing two bills this morning. And if you would like to watch as well as listen, you can go to our YouTube channel. You can find that at legislature.maine.gov and go to the Health and Human Services webpage, where you can find a link to our very own YouTube channel. Everything's recorded today, and past meetings have also been recorded and are available for review. We are regularly encountering some technical difficulties, so we ask that you bear with us while we deal with those. Usually it's a matter of getting people who are wanting to testify hooked up and into the committee for their testimony, but other things have happened too. We might be joined by a bird, a parrot, or a cat along the way. We've seen that also. So we'll be hearing from people today in response to a bill to be introduced, two bills to be introduced. Just remind everybody, this is a public hearing, and we're here to hear when we're here so we can hear from the public about their thoughts about the bills. You may get questions from around from the committee members, but they should be questions only. We'd ask that you limit your testimony to 3 minutes. We understand that may be a challenge for some, and we'll try and recognize and appreciate that. So those are the introductory remarks. Let's go ahead and introduce ourselves around the virtual horseshoe and start with Representative Griffin.
Good morning. My name is Abigail Griffin. I represent House District 102, which is Glenburn, Levant, and Kudeske.
Representative Craven.
Thank you, Mr. Chair. Good morning. I'm Margaret Craven, and I represent House District 59, which is part of Lewiston.
Representative Madigan.
Good morning. I'm Colleen Madigan. I represent House District 110, which is part of Waterville and part of Oakland.
And Representative Lemlin.
Good morning. My name is Michael Lemlin. I represent District 88, Chelsea, Jefferson, Whitefield, and half of Noblesboro.
Thank you. Representative Stover.
Good morning. My name is Holly Stover. I represent House District 89, including the towns of Boothbay, Boothbay Harbor, Southport, Edgecombe, Westport Island, and part of South Bristol.
Representative Perry.
Good morning. I'm Ann Perry. I represent House District 140, which includes the communities of Indian Township, Baileyville, Barron, Calais, Charlotte, Robbinston, Perry, Pembroke, and Pleasant Point.
Senator Moore.
Good morning. I'm Marianne Moore, and I represent Senate District 6, which is all of Washington County, as well as Goldsboro, Winter Harbor, and Sullivan in Hancock County as well.
Representative Meyer.
Thank you, Mr. Chair, and thanks to everyone who's come to view our proceedings, and especially those who come to bring testimony. I'm Representative Michelle Meyer, serving Southern Maine's House District 2, which is all of Elliott and parts of Kittery and South Berwick.
And I'm Ned Claxton. I represent Senate District 20, which consists of Auburn, Minot, Mechanic Falls, Poland, and New Gloucester. As you may have heard us referring to before, there are people who are the glue for the committee, one of whom is Ms. Dooling.
Good morning. My name is Erin Dooling. I'm one of the legislative analysts for the Health and Human Services Committee from the Nonpartisan Office of Policy and Legal Analysis.
And the other is Ms. Withy.
Good morning. My name is Carrie Withy. I'm the clerk for the Health and Human Services Committee. If you need any assistance during the hearings, you can email me at hhs@legislature.maine.gov.
Very good. Are there any other points to cover before we start hearing the first bill? And we'll start with LD 718. And that would require Representative Talbot Ross to join us and present the bill. So welcome, Representative Talbot Ross. Thank you for joining us.
Thank you very much. And good morning to all.
The floor is yours.
Thank you, Senator. Senator Claxton and Representative Meyer and distinguished members of the Joint Standing Committee on Health and Human Services. My name is Rachel Talbot Ross, and I represent House District 40, which comprises the Portland neighborhoods of Parkside, Bayside, East Bayside, Oakdale, and the University of Southern Maine campus. I want to thank you for the opportunity to present this critically important bill, LD 718, an act to improve the health of Maine residents by closing coverage gaps in the Maine Care program and the Children's Health Insurance Program. This bill provides a critical opportunity to close gaps in our healthcare system by ensuring all low-income Mainers have access to Maine Care, regardless of their immigration status. This much-needed legislation is straightforward. Any Maine resident who is income eligible for Maine Care, but not allowed to enroll in Medicaid due to federal restrictions for certain immigrants would be eligible for our state Maine Care program. Before I get into more details of who would be impacted by this legislation and other details about how it would work, I want to say a little bit about why it's so important. The bill title says we are seeking to close gaps in coverage, but it could more accurately say we seek to close gaping holes, given the racial and ethnic disparities in health that Black and Brown Mainers have experienced since we first started collecting data about disparities, and that we most recently saw as a state with the worst disparities in our nation for COVID-19. Those disparities did not harm immigrants, only harm immigrants, but all Mainers of color, including Indigenous, African Americans, and members of Maine's tribal nations. And there are many systemic challenges that contribute to those disparities. But we cannot ignore the fact that people without access to healthcare, like immigrants who are currently excluded from Maine Care, are more vulnerable to COVID-19 and any other illness. Lack of preventative care and care for chronic conditions like asthma, cardiac and lung diseases, and diabetes makes people more susceptible to the virus and more likely to suffer more serious illnesses from the virus with more complications. The disregard for the health of so many immigrants in Maine is even more troubling when we consider that immigrants are often working in essential jobs in vital industries. Our immigrant neighbors are critical to every facet of our food systems, from growing to processing agricultural products and seafood to working in our grocery stores and restaurants. They are working throughout our tourism and hospitality industry, a critical sector of Maine's economy. And they are filling essential jobs in every part of our healthcare sector, especially providing care to older Mainers and people with disabilities. Immigrants contributed $62 million in state and local taxes in 2016. On average, immigrants who come to Maine are more likely to have advanced education and start businesses in Maine, creating or helping to retain thousands of jobs. Maine immigrants are leaders in our communities. They are learners in our schools, members of our congregations and mosques. They are our family, friends, and neighbors. They are an integral part of our lives here in the state. And like all Mainers, they need and they deserve healthcare. Federal restrictions on Medicaid were instituted in the mid-90s. Here in Maine, 25 years ago, the legislature voted with bipartisan support to continue providing Maine Care for income-eligible immigrants. So 25 years ago, I'll say it again, the legislature voted with bipartisan support to continue providing Maine Care for low-income eligible immigrants. Then, in stark contrast to that long-standing practice, that eligibility was cut for many immigrants at the start of the LePage administration in 2011. That harmful decision impacts Maine immigrants of all ages in towns and cities across our state. Some examples of the people who are impacted include those who are lawful permanent residents who have had their green cards for less than 5 years, most asylum seekers, people who are caught up in data errors in the federal SAFE system, and yes, people who are here without documentation. I really want to emphasize that every Maine resident needs and deserves healthcare. Their health affects our collective public health, and we must close these holes in our healthcare safety net. This bill, LD 718, would use state funds to cover the care for immigrants who are not eligible for federal Medicaid or CHIP. Some care would be eligible for a federal match, such as emergency care, or by using the state option to cover pregnant people through CHIP. The bill also directs the state to take advantage of any future opportunities to utilize a waiver or state option to seek federal funds for some or all of the coverage provided in this bill. We don't have a fiscal note as of yet, but based on previous bills that would have provided much of the same coverage, as well as other data, advocates estimate that the cost would be between $5 million and $7 million annually. That is a relatively small price to invest in the health and well-being of Mainers. You're going to hear from others today who will give you a more complete picture of the importance of this legislation, and they will be able to answer your questions, any technical questions you have related to this bill. I simply ask that you listen to their words with an open mind and heart. LD 718 would help Maine take a huge step forward in ensuring all Mainers have access to health care and in reducing damaging health disparities experienced by people across the state. I am extremely proud to sponsor this bill, and I want to say thank you to all of the work from so many that went into making this bill possible. And I want to acknowledge their leadership and resiliency in the face of so much discrimination. I thank you for your time and attention. And as I said, there will be folks who follow me who will have answers to some of your questions. I thank you for your attention and time.
Thank you, Representative. Are there any questions for Representative Talbot Ross? I see one from Representative Craven.
Thank you, Mr. Chair. Thank you, Representative, for bringing this really important bill. Do you know how many people are affected by the lack of health care because of this, this discrimination?
Right. There are, I know that when we expanded healthcare back in 2017, and we were able to provide healthcare for over 76,000 people at a critical time, we were able to capture some data about the still gaping hole that remained by not covering folks due to immigration status. But I do not have that number. I can absolutely provide it if those who come after me are not able to give you that exact figure. I think it is safe to say that due to the relatively small fiscal note, we're not talking about a lot of folks, but I'll give you that number as soon as I can.
Thanks. I was just wondering about tribal members, you know, why they would be lacking the ability to have Maine care.
Okay.
Well, I'm sorry, Senator.
No, please go right ahead. Yeah.
Yeah, a lot of the reference to tribal members is to really highlight some of the health inequities and disparities, not necessarily about coverage for the bill.
Are there other questions for Representative Talbot Ross? I don't see any, so thank you for bringing this forward. Before we get into testimony, we just to remind people, we start with people who are supporting the legislation, then we hear from people who are opposed, and then we hear from people who are neither for nor against. I'd ask as we go through the testimony that if a point has been made earlier, that we avoid as much repetition as possible. Really, we're here to hear your stories and to help us better understand the bill. The other point I want to make before we start is that I'm sorry about last names. I am going to mess up a bunch of last names today, and I want to apologize in anticipation of that. It's not out of disrespect, it's out of not knowing. So that said, I'm going to try and make a mess of Mr. Saeed's last name and welcome him to unmute and testify. Welcome.
Good morning, Senator Claxton, Representative Mayor, and the member of the Joint Standing Committee of Health Human Service. My name is Abdul Karim Saeed. I live in Auburn, and I am also the Executive Director and the founder of the New Manor Public Health Initiative. I am here today to testify in supporting of LD 718. As a result of ACA, almost 23 million Americans gained healthcare access. In our state, through the main care expansion, more than 70,000 people gained access to the coverage. However, many low-income immigrants were not covered under main care expansion due to a federal regulation. LD 718 will close gaps to access to care for many low-income immigrant and marginalized communities. At the New Manor Public Health Initiative, we see firsthand harmful these gaps in coverage are for immigrants in our community. We work closely with DHHS and other organizations like Consumer for Affordable Healthcare Access to assist people with enrolling in healthcare coverage like main care or a marketplace. But too many times we have to tell people they are not eligible for a care or a marketplace. For a care of marketplace. For too many times to people to tell not eligible for any coverage because of the immigration status. This causes people to avoid preventive care or a condition that needs attention until they become an emergency. This is not a smart way that we can care for the resident of our state. The poor infrastructure of the public health in our state and the higher health disparity experienced by the people of color in our state were highlighted during the pandemic. My organization and many other organizations have worked tirelessly for the last year to address this issue in a pandemic, put shining a light on existing health inequality in the access of healthcare. During the pandemic, Maine has the worst racial ethnic disparity in COVID-19. Lack of access to the coverage has been a significant factor for the low-income immigrant and marginalized communities. Most of them are frontline workers like me. During the pandemic, they are more vulnerable to the virus because of the type of the work they do. And
30
because
seconds, sir.
And because of the lack of health, it can lead to health conditions that the COVID-19 more dangerous to them. There are a few programs that can give access to the coverage without like emergency and hospitals free care. However, this do not cover preventive care. Many immigrants without coverage have to wait until they get severely sick and run to emergency room. If you pass this bill, all the immigrant population will have not covered through the main care gap, and that gap will close. They finally have to access need health care, all others like Maynard. And I thank you all.
Thank you for your testimony, sir. Are there any questions of Mr. Saeed? I don't see you. Any? Thank you for being here. Now we can go to Ms. Conroe.
Senator Claxton, Representative Meyer, and honorable members of the Joint Standing Committee on Health and Human Services. My name is Allison Conroe, and I live in Portland. I am here to present testimony from the Maine Mobile Health Program, MMHP, in support of LD 718. MMHP supports LD 718 because we believe that providing Maine care to everyone with low incomes will keep Maine families healthy and safe, as well as improve access and sustainability in the Senate healthcare system, or the state healthcare system. For over 25 years, MMHP has addressed the health needs of migrant and seasonal workers and their families. We are the only nonprofit organization in Maine acting as a safety net health provider for farm workers. Annually, as a federally qualified health center, we provide mobile care to 1,300 patients in their communities. MMHP aims to reduce health disparities and inequities from Cumberland to Washington to Aroostook counties. Since the implementation of the Affordable Care Act, we have enrolled hundreds of farm workers in private insurance and Maine Care. Farm workers are the backbone of Maine's agricultural economy. Our patients rake blueberries, pick strawberries, broccoli, and apples, make Christmas wreaths, and harvest Christmas trees, as well as process lobsters and sea cucumbers. The vast majority, 86% in 2020, of our patients live below the poverty line, despite their significant contributions to our economy. We serve a diverse patient population, including individuals who would benefit from the proposed legislation. Even though many of these patients live and work and raise their families in Maine year-round, often they are ineligible for Maine Care. LD 718 would have a profound impact on our patients' ability to keep themselves and their families safe and healthy. As the health center in state with the highest uninsured rate at 93% in 2020, we have seen firsthand how the lack of access to insurance impacts health outcomes, delays critical care, as well as wreaks havoc on the medical system. Patients without insurance avoid lower cost primary and preventative services, which leads to increased utilization of emergency rooms and hospital stays. Our staff regularly report that our patients delay or avoid care because they fear that they will be unable to pay the bill. Additionally, every uninsured patient that gains coverage, like Maine Care, relieves some of the burden on overstretched health center budgets and allows providers to operate in a more stable, sustainable model. I'd like to share a story of an MMHP patient who was uninsured and needed an operation that could not be provided by our health center. This patient had already accrued outstanding hospital bills that he did not have the means to pay for them. The bills were in danger of going to collections, and he was worried he would not be able to undergo the needed operation. I worked with the patient to try to find a financial assistance program that would help him get his operation and allow him to return to good health. First, we applied to the state, but the patient was denied Maine Care. We then attempted to apply to the marketplace for private insurance, but he was again denied coverage. Finally, we tried the hospital free care system, but the hospital did not approve his application. At the end of the day, after all the stress and effort, the patient did not receive the medical services he needed. Our health center is required by law to provide care to anyone in need, regardless of how they come to Maine. We do not turn anyone away from our primary and preventative care services. We believe that our state's safety net system should do the same. Access to medical care is a problem, and Maine has an obligation to address it. And we believe that our state should address this problem for everyone, not just a select group. Please support LD 718 to keep our patients and their families safe and healthy. And thank you for your time.
And thank you for that testimony, Ms. Conroe. Are there any questions? I don't see any. Thank you for being here and for bringing that forward. Yes, there are questions. Representative Madigan.
Thank you, Mr. Chair. Thank you, Ms. Conroe, for being here. When Representative Talbot Ross presented the bill, one of the things I was thinking about was just migrant workers and the folks that work on a lot of our farms. So I'm wondering kind of if you could speak a little bit more about the amount that do live here year-round, and if they have children and all that, because I'm very concerned that folks that are really kind of the backbone of our economy, you know, picking the crops that serve Maine people, aren't getting healthcare. The story you told was quite compelling.
Yeah, so we, on average, I believe the last time that there was census or data tracked on how many migrant farm workers had entered the state was in 2012. And around that time, I believe the number was about 12,000 people in the state. It's hard to track because this is a hard to reach population. So oftentimes the data is not exact and it's hard to get those numbers. That being said, I would say we have a good portion of patients that live in the state year round, although we also have a larger influx of patients that come in for the harvest season. Harvest seasons can range anywhere between a few weeks to more than half of a year. So with COVID-19, that also changed a lot of ways in which people travel as well.
And just one follow-up. One of the things I've noticed the past few years is there seems to be more migrants kind of working along the coast, lobster pounds and other stuff in fisheries. Does this population include those folks that come in for just the influx of business we have during the summer months?
So I would say that it includes, yes, any of the folks that come in to work in those industries and seafood as well, whether that be due to an influx of the economy at the time or due to the seasonality of the crop and the harvest.
Thank you.
Representative Craven.
Thank you, Mr. Chair. Do you provide vaccinations and immunizations and that sort of thing for the people that you see?
MMHP directly has provided flu shots in the past for patients through mobile care units. We also help connect patients to voucher care providers or private practices around the state that can set them up with those vaccinations. With the onset of the COVID-19 pandemic, we have been facilitating a way to begin vaccination clinics for our patients, and we have also helped patients connect to COVID-19 vaccinations in their local regions.
Okay, I don't see any other questions. Thank you for being here. Next, we can go to Ms. Osman. Welcome. If you want to unmute and testify, we'd like to hear from you.
Hi, Senator Claxton, Representative Mayer, and honorable members of the Joint Standing Committee on Health and Human Services. My name is Amran Osman. I live in Lewiston, Maine, and I am here today to testify in favor of LD 718 and to read the testimony of my classmate and close friend, Ilham Mohammed. My name is Ilham Mohammed, and I am in favor of this bill because I strongly believe that this bill will aid many immigrants. I believe that once COVID-19 hit, Maine has seen the most of the worst racial and ethnic inequalities. The provision of simple health care led partly to an increased risk to the pandemic for many low-income immigrants. Many immigrants, as myself, are left to struggle until it leads to an emergency to be cured without insurance benefits, jeopardizing our health and placing more burden on our families. Infections and diseases that can normally be treated are life-threatening because we are without treatment. Lack of health insurance influences the success of children in schools, as well as their desire to provide for themselves and their families with economic stability. I am a low-income immigrant, and Maine Care does not entitle me to receive care due to my immigrant status. Statistically, people of color are more prone to diseases because they don't have the resources that others do, which leads to these problems becoming worse. Recently, I kept getting constant lumps all over my body where it became so inflamed that I needed an incision. Since I don't have Maine Care, I was afraid to be seen by a doctor, so I kept going back to urgent care. However, I was told by the physician assistant that kept seeing me that she would have to refer to me to another doctor in a hospital. At that moment, I knew that I had to pay out of pocket, and as a college student, I cannot afford that. I try to work as much as I can, but schoolwork takes up most of my time, and the money I do goes straight to my family. My mom is a single mother, and one of my siblings is autistic, so money is crucial for us, and I shouldn't have to choose between helping my family and my health. I would really love and appreciate Maine Care, and I urge you guys to pass this bill.
Thank you for that testimony. Are there any questions of Ms. Osman? I don't see any. Do I understand that Mr. Isazu is with you? If you want to go ahead and testify, sir, welcome. And again, I apologize if I've messed up your last name. We need you to unmute before we can, there we go.
Yeah, sorry. It's Isazu. I can't see. Sorry.
Go ahead.
Senator Claxton, Representative Mayer, and honorable members of Joint Standing Committee of Health and Human Services. My name is Chance Isazu. I live in Bangor, Maine, and I'm here today to testify in favor of the LD 718. I am here to testify in favor of this bill because I firmly believe that this bill will help hundreds of immigrants in my position. I'm a 22-year student who migrated to the United States at the age of 14 with my little sister and was placed in foster care. When migrating to the foreign country, the fear of unknown can cause mental illness. I had Maine Care until the age of 21 and sadly found I was not eligible for Maine Care due to the green card status. I have suffered from anxiety and depression, and being blindsided with the unknown of how to treat my mental illness made me go into a dark place. I believe that healthcare should be a fundamental human right. I am not a citizen of this country. Still, I fulfill my duty as a civilian and pay my taxes like everyone. So why am I being discriminated against for healthcare? Once I turned 21, I lived with the constant fear of what if I can't. Wait, computer.
Take your time. Take your time.
Sorry.
No.
Sorry, my computer just stopped working. What's happened? I'm sorry. Okay. Okay, it's fine. I found it. Okay, sorry. In this country, to fulfill my duty and pay citizens. So why am I being discriminated against for healthcare? Once I turn 21, I live with the constant fear of what if? What if I cannot afford my inhaler? What if I cannot afford my medication? I had to suffer through asthma, depression, and anxiety without getting any help from professional because I could not afford it. While my other peer could go to the hospital whenever they want, and I was forced to live in the silence, even though there was no difference between us rather than our status. Have any of you have suffered from mental illness and have to skip one day of medication because you are afraid you have no other way of getting your medication back? I had to take medication in moderation and skip days when I did not feel like I would get a refill. That is what I did when I found out I was not eligible for Medicare. And that's what many immigrants do because they do not have health care. People are forced to suffer in silence and make choices between health and bills. For that, I support this bill.
Thank you for your testimony, Mrs. Azu. Are there any questions of her? I don't see any. Thank you for being here and working through the technical problems, which I said we were going to run into. Next, we're going to hear from Ms. Stewart.
Good morning, Senator Claxton, Representative Meyer, and honorable members of the Joint Standing Committee on Health and Human Services. My name is Andrea Stewart, and I'm a resident of Stillwater. I currently serve on the board of Welcoming Immigrant Neighbors, also known as WIN Bangor. I'm submitting testimony in favor of LD 718. WIN Bangor strives to help our new neighbors meet basic needs, access essential services, find social supports, and experience a warm welcome to our shared community. My hope as a volunteer with WIN is to befriend new Mainers and help them integrate into the community. Though much of my time has been spent helping people fill out main care forms, sliding scale fee applications, and other medical forms, which are often only provided in English. Last year, I helped the same individual apply to main care multiple times so they could be denied, because in order to receive the current piecemeal medical services offered, you must first be denied main care. Due to the lack of access to proper healthcare coverage, there's a much lower utilization of the healthcare system. Without coverage or the means to pay for care, people will delay seeking medical treatment until the situation has become emergent. Consequently, this leads to an increase in advanced disease because people have no other option but to wait, accruing costly medical bills instead of receiving preventative care, and the burden of these costs is felt by all of us. Approximately 50% of the children WIN serves have not received any medical treatment since moving to Maine. They have rarely received a hearing or vision screening, which only exacerbates the difficulties they are already facing in school. One 12-year-old boy was referred to an eye doctor by his primary care, but we had to cancel this appointment because there's no sliding scale fee or coverage for eye care, and his family could not afford the out-of-pocket costs of a $150 minimum eye exam, let alone an eyeglasses prescription. Penobscot Community Health Center is currently the only health center offering dental services on a sliding scale fee. PCHC is limited capacity, and their new patient intake usually opens once every few months for 24 to 48 hours, during which time you must call in and put your name on a list. Getting your name on this list does not guarantee an appointment, but rather with the possibility to receive an appointment. We had a 6-year-old boy who had 21 cavities. These are not small cavities, but when he opened his mouth, his teeth were completely black. There's no coverage for his dental needs. Immunizations are now required by the state of Maine for all children in public schools. Fortunately, there are public health clinics offering immunizations to kids at no charge except the $15 administration fee. For adults, it's a much bleaker outlook as the fees are not waived and a single dose of MMR costs $100 plus a $15 administration fee. As I'm sure we're all aware, not having access to immunizations is a public health issue.
30 seconds, Ms. Stewart.
Thank you. The current system is inefficient, ineffectual, and costly to everyone. The collective well-being of our communities is tied to every individual being able to access adequate health care. Thank you, Senator Claxton, Representative Meyer, and members of the committee for your consideration of LD 718. I strongly encourage you to pass LD 718 and close this gap in our healthcare system. I'm happy to answer any questions you might have.
Thank you. Are there any questions of Ms. Stewart? I don't see any. So again, thank you for being here. Next, we can go to Ms. Wolf. Welcome.
Good morning. Senator Claxton, Representative Meyer, and members of the Health and Human Services Committee. I'm writing and talking now to support LD 718. I am not an asylum seeker myself, but over the past couple years, I have become substantially involved in various volunteer endeavors to help asylum seekers find stability and safety here. So I know many of them and I know their stories. One of the things that most impresses me is the enormous amount of stress these people carry with them. It originated with the traumas they fled, but is compounded by the precariousness of their lives here and the difficulties of making their way in a totally new environment, usually with a new language, learning how to do everything all over again. Their resilience never ceases to amaze me, but the struggles are constant and sometimes it seems like it is all too much to bear. And if we could just make one or two of their worries go away, it would at least give them some breathing room to manage the others with more ease and find their footing. Health needs are among the most stress-inducing because they can be life or death or affect quality of life significantly. Most of the families I have gotten to know consist of young adults and their young children, so they are not likely to have major chronic health problems the way older people would. But when they do have problems, and several that I know got COVID and one of them was hospitalized, these instances cause enormous additional stress on them and on the entire family. In my volunteer circles, I know of one woman whose teeth were falling out due to gum disease brought on by months in detention centers being unable to eat due to the stress, and a child who needed eye surgery. It takes volunteers untold numbers of hours trying to find help from centers or individual practitioners willing to volunteer their time for these procedures, and often we can't find anyone. The stress of suffering health problems on top of the PTSD and nightmares from everything they have fled, and especially of parents seeing their children suffer, can be the last straw that knocks them off a path toward acclimation and thriving. This will probably have long-term repercussions as these people have less and less psychological energy to meet the next challenges. Not having access to healthcare also sends a strong signal to them that they do not belong and are not welcome here. This is exactly the wrong signal to send when Maine desperately needs immigrants to come here and stay here to hopefully maintain and grow our population. In fact, if Maine had a humane and inclusive approach to healthcare for immigrants, it could help us entice more to come, and then we would benefit from their presence and, of course, their taxes, the businesses they would start, and their labor. Immigrants among us are often in essential jobs that benefit the rest of us. They pay taxes, but they are not offered employer-sponsored health insurance, and they currently don't have right to that basic services like healthcare. Maine traditionally did have healthcare benefits for immigrants who were income qualified, and this bill would just restore what was lost a decade ago. So I urge you to vote ought to pass on LD 718.
Thank you, Ms. Wolf. Are there any questions of this testimony? I don't see any. Thank you for being here. I see we've been joined by Senator Baldacci. Would you care to introduce yourself, sir?
Thank you very much, Mr. Chairman. I'm Joe Baldacci. I am from State Senate District 9, which is the city of Bangor and the town of Herman. Good morning.
Good morning. Next, we're going to hear from Ms. Wartell. Looks like you're unmuted. Please go ahead when you're ready. I'm not sure if you're showing a video or not, because we're not seeing you. Nor are we hearing you. So we can ask Ms. Withy to see, and well, I see that she was able to mute herself. We can ask Ms. Withy to try and get in touch with Ms. Wartell and see if we can establish connection. In the meantime, we'll go to Mr. Conniff. Welcome.
Senator Claxton, Representative Meyer, members of the Health and Human Services Committee, thank you for giving me the opportunity to speak in favor of this important bill, LD 718. My name is Ben Conniff. I'm a co-founder of Luke's Lobster. We're a vertically integrated seafood company that buys directly from fishermen, runs our own production facility, and operates a group of restaurants in Maine and around the country. We handle over 5 million pounds of lobster a year, 2 million pounds of crab, as well as Maine scallops, halibut, tuna, groundfish, kelp, and more. We're a certified B Corp, which means that we prioritize our impact on our community and our environment alongside making a sustainable profit. You've already heard, you'll hear plenty today about the incredible moral imperative of passing this bill, so I'll speak to the more pragmatic reasons. Maine's seafood industry relies to a huge extent on our immigrant population. They do the hard work to turn live lobster and other seafood into the products sold in restaurants and grocery stores around the state and beyond. I've never been to a seafood plant where immigrant employees were not the backbone of the operation. And without immigrant workers, the market for many of Maine's seafood products would collapse. Yet, working in a natural resource-based industry with seasonal and weather fluctuations, it's difficult to get predictable full-time work with benefits. Many immigrants balance multiple part-time jobs or have to balance part-time work with family care, which makes them ineligible for employer-sponsored health care. Immigrants in food production stepped up and put their health on the line during COVID-19 while many others stayed home, demonstrating resilience to yet another trauma on top of so many they've already faced. Their contribution ensured that food was available to all, and that means critical fishing and farming industries stayed afloat. After everything the immigrant community has contributed to our state, to not take this opportunity to remove an inequitable barrier to affordable health care would be morally unjust, and it would be a terrible decision for Maine's businesses. Health and wellness in our working community, including the ability to get preventative care and treatment affordably, is critical to Maine's economy. We're facing a huge shortage of employees in our state. We need to do everything we possibly can to be welcoming, safe, healthy, and equitable to folks considering a move to Maine to help keep our economy moving. And that starts with passing this law. So I urge you to do so. And I thank you for your time.
Thank you for your testimony. Are there any questions of Mr. Conniff? Not seeing any. We'll go to Ms. Silvius and hear from her. If you'll unmute and join us.
There we go.
There we are.
Good morning, Senator Claxton, Representative Meyer, and members of the Health and Human Services Committee. My name is Carolyn Silvius, and I'm from Portland. I am an advocate for Homeless Voices for Justice and a newly elected member of the Maine Green Party Steering Committee. I wish to speak in favor of LD 718 from both perspectives. There are a couple of reasons why I believe that LD 718 must be enacted. First and foremost is that healthcare is a basic human right. It is not just a right for those who qualify under certain arbitrary conditions like citizenship or access to general assistance or federal regulation. It is a right for all humans. Allowing any person to suffer because he or she cannot afford to see a doctor is not only cruel, it is immoral and unconscionable. In 2017, Maine voters approved an expansion of MaineCare, which has allowed many more people to access the health care they deserve. The Maine immigrant population is only about 2% of the total population. So allowing immigrants access is only a small and reasonable extension of that same expansion of Medicaid, of MaineCare, sorry. The other reason that LD 718 must pass is that it not only will affect the income eligible immigrants, it will affect every taxpayer in the state. Without access to affordable health care, when a person gets sick, he is unlikely to see a doctor and will try to treat what ails him by himself. The usual result of this policy is that the illness worsens, and by the time he gets emergency care, the treatment is 2 or 3 times more involved and expensive. Further, if the disease is contagious, he may not know it and will have spread it far and wide. Germs don't discriminate. They attack the wealthy as easily as they attack the poor. The final result is that all taxpayers in Maine end up paying and suffering more than they would have had the ailment been caught and treated early. Please support LD 718 in your work session. Healthcare for immigrants is a human right and ultimately a savings for the wealthy and working class taxpayers alike. Thank you.
Thank you, Ms. Silvius. Are there any questions? I'm not seeing any. So now we can go to Ms. Wartell. Thank you for your persistence.
Thank you. Thank you, Senator Claxton, Representative Meyer, and members of the Joint Standing Committee on Health and Human Services for hearing me today. My name is Becky Wartell. I'm a resident of Gorham and a member of the Southern Maine Workers Center. I'm here today to speak in support of LD 718. I'm a member of the Southern Maine Workers Center Healthcare is a Human Right campaign, and I'm here to say that as core, healthcare is a human right, and this is an important piece of the healthcare puzzle state in making sure that every single person in our state is access to healthcare that they need. It's going to lead to us being a stronger and healthier state as a whole. Especially the last year of all of us living through the COVID-19 pandemic. Qualities in our system have been highlighted, as well as the necessity of access to healthcare for every single person in our state. And also the realization of how deeply interconnected each and every person's health is, and how every person in our state's health impacts everyone else's. This is a step towards making Maine a healthier state overall. It's more apparent than ever how important it is to close these gaps in our system to make sure that everyone is able to access good care. It's also been shown time and again that access to things such as healthcare after the fact, people have been putting things off for too long because they're afraid of healthcare costs, and only accessing healthcare when it's an absolute emergency ends up costing the state, hospitals, our economy more money in the long run. So making sure that people feel comfortable accessing healthcare early on before it becomes an emergency is essential. Thank you so much for your time.
Thank you for your persistence and your testimony. I don't see any questions. Before I go to Mr. Dingman, I just want to note that everybody will be hearing a 30-second warning as we go along if things are going well. So thank you. So now we can go to Mr. Dingman. Welcome, sir.
Thank you, Senator Claxton, Representative Meyer, and members of the Committee on Health and Human Services. My name is Charlie Dingman. I am with the law firm of Kozak and Geyer, and I'm appearing before you this morning on behalf of the Maine Primary Care Association to express our strong and unequivocal support for LD 718. We have submitted through Marge Kilkelly of Maine Primary Care Association some written testimony. I want to supplement that testimony this morning. First of all, I'll mention that the Maine Primary Care Association is the member association that includes all of Maine's 20 community health centers. Those centers provide comprehensive medical, behavioral health, and dental care for about 1 in 6 of Maine's people. They are the largest primary care network in the state. They're at the forefront of delivering care in rural and underserved communities, and they serve patients regardless of their health insurance status or ability to pay. And that is part of their mission as nonprofit health centers. And consequently, they strongly support and recognize and see on a daily basis the critical importance of delivering needed health care to everyone in Maine who needs that care. And that is the objective that would be advanced by this bill. Ms. Kilkelly's testimony, which you will see in the file, emphasizes the extraordinary ways in which children can be negatively affected by not receiving the care they need when they need it. It makes a difference in their lifelong health status. It makes a difference in hospital and emergency room burdens. It lowers mortality rates and has other impacts that Marge has detailed in her written testimony. We want to emphasize as well that extending that same coverage to adults is equally important. You've already heard from one member of the Primary Care Association this morning, the mobile health program, and other health centers have similar experiences. People who work and live in Maine who struggle with the backgrounds that have led them to seek asylum here or have other reasons to be here all need health care and all contribute to the long-term strength of Maine's economy and community. We urge the committee to support LD 718. I'd be pleased to answer questions or to provide additional information from health centers if that would be helpful to you as you deliberate on this bill. Thank you.
Thank you, sir. Are there any questions for Mr. Dingman? I was looking while you were talking to see if I could see Ms. Kilkelly's testimony, and I'm not seeing it. We got lots of stuff, so we might need to submit it again. Do you see it, Senator Moore? No. Okay. So yes.
We will do that, and I may submit a written supplement. Her testimony focuses only on the children's portion, and we really do want to support the entire bill.
Very good. Thank you.
Thank you.
All right. Next, we're going to several people at one computer. We'll start with. Why don't you introduce yourself? Why don't you introduce yourself?
Yeah, my name is Crystal Cron. Thank you.
Okay.
Senator Claxton, Representative Meyer, and honorable members of the Joint Standing Committee on Health and Human Services. My name is Crystal Cron. I live in Portland. I am the president of Presente, Maine, and I work with over 2,000 seafood processing workers and their families who have no healthcare coverage. And I'm here today to testify in favor of LD 718. For decades, I've been watching the state of Maine grow and prosper on the backs of my neighbors and family. While they provide the labor for the largest and most booming industries in Maine, agriculture, lobster processing, construction, tourism, and hospitality, our state denies them their most basic human right, the right to health and to life. Even when they have raked thousands of crates of blueberries, shucked hundreds of thousands of pounds of lobster, harvested broccoli, packed potatoes, washed our dishes, cooked our meals, built our houses, and cleaned our toilets, they cannot afford to go to a simple checkup at the doctor. People are delaying care that they can't afford to be putting off. Parents agonize over the right moment to take their kids to the doctor. They sacrifice their own health and care so they can at least take their children. We have seen the devastating impacts of delaying care play out in this pandemic. Rates of infection for Black and Brown communities far outnumbered those in the white community. And that was just among those who tested. Not having access to basic interventions for diabetes, high blood pressure, and asthma means being more medically vulnerable, which means being at much higher risk of complications and life-threatening outcomes when contracting COVID. Many people in our community got very sick, and they waited until the last possible moment to seek life-saving treatment, and sometimes not at all because of fear of not being able to pay. My own family is a mixed status household. We cannot make even the most basic healthcare decisions without considering cost. We can't pick the providers or practices we feel most comfortable with. My son immigrated to this country with his father when he was 1 year old. They came here fleeing violence and poverty and hoping to find a better life. I've had the privilege of raising him since then. He is almost 4 years old now. He doesn't know anywhere else but Maine as his home. He loves our neighborhood. He loves our community garden plot. He loves the ocean. He talks to all the neighbors when they walk by. He doesn't know yet that he's not considered a person deserving of health care. He doesn't know he is a second-class citizen. He doesn't have to think about it yet, but I do every day.
30 seconds, Ms.
Pregnant. We are about to welcome a new child into our family. That child will have access to healthcare coverage, but my son still won't. How can I live with one child being worthy and my other child being unworthy just because of where they were born? How can I feel like a good mom if I can't ensure my child the same healthcare coverage that my newborn will be afforded? I'm urging you to support this bill because healthcare is a human right. Support this bill so I don't have to tell my son why he can't go to the doctor. Support this bill so the thousands of people that I work with in my community can experience the relief of having access to a doctor. Support this bill to protect our communities and to support those who support all of us. Thank you.
Thank you, Ms. Cron. Are there any questions of this witness? I don't see any. Thank you for being here. I understand you're joined by some other folks there. Welcome, Mr. Ramirez. Welcome.
Gracias, señor. Senador Claxton, representante Mayer y miembros honorables del Comité Permanente Conjunto de Salud y Servicios Humanos, y a cada uno de los que están aquí presentes en este momento. Me llamo Edia Ramírez, llevo 2 años viviendo en la ciudad de Portland, Maine.
Yeah, I'm going to interpret. Senator Claxton, Representative Meyer, and members of the Joint Standing Committee. My name is Edia Ramirez, and I have been living in the city of Portland for 2 years.
Es un estado muy maravilloso y me he enamorado de su cultura, su diversidad vegetal, su clima bastante peculiar, entre otras lindas cualidades. Es un lugar que no pienso abandonar fácilmente, pero hay algo que me mantiene preocupado y es el tema de la salud, tan imprescindible como la vida misma. Y yo, en condición de un agente de cambio y parte del desarrollo del estado de Maine y de este país, considero que es un derecho humano y que lo merezco tanto por existir como por lo que hago por el desarrollo de la economía local.
Maine is a wonderful state, and I have fallen in love with its culture, its plant diversity, and its peculiar climate, among other beautiful qualities. It is a place that I do not intend to leave easily, but there's something that keeps me worried, and it's the issue of health, as essential as life itself. And I, as an agent of change and part of the development of the state of Maine and of this country, I consider that health is a human right, and I deserve it both for existing and for what I do for the development of the local economy.
Cuando mi hijo o yo nos enfermamos, mi salud mental se deteriora a gran nivel. Pues no sé si hacer una visita al médico o quedarnos en casa esperando a que nuestro cuerpo sane por sí mismo. Porque pienso mucho en que a mi buzón llegará un sobre con una factura diciéndome cuánto debo pagar y no tengo dinero para pagarlo.
When my son or I get sick, my mental health deteriorates to a great level because I don't know whether to visit the doctor or stay at home waiting for our bodies to heal themselves. Because I think a lot about how an envelope will arrive in my mailbox with an invoice telling me how much to pay, and I don't have the money to pay it.
No he venido aquí para contarles mis desgracias, sino para pedirles en nombre de mi comunidad, aquellos que también viven en igual o peores situaciones que en las que yo me encuentro, que tomen en consideración nuestra petición a la aprobación de esta moción de ley y así salvaguardar la vida y la salud de nuestros hermanos y hermanas. Sin más que decir, espero solemnemente la sabia decisión de cada uno de ustedes. Muchas gracias.
I have not come here to tell you about my misfortunes, but to ask on behalf of my community, those who live in the same or worse conditions than those in which I find myself, to take into consideration our request for approval of this bill and thus safeguard the life and health of our brothers and sisters. Without more to say, I solemnly await the wise decision of each of you. Thank you.
Thank you, Mr. Ramirez. Are there any questions of Mr. Ramirez? I don't see any. Buenos dias.
Buenos días.
Are there, and I understand there's a Ms. Ontiverius?
Bueno, buenos días. Mi nombre es Rocío Ontiveros y vivo en Lewiston. Y regularmente durante todos los años que he estado viviendo aquí. Para empezar, es un estado que a mí me fascina. Estoy ayudando a las personas hispanas que viven en este estado, que no tienen posibilidad de ayuda. Durante el tiempo que he estado como voluntaria ayudando en las necesidades de cada uno de ellos, ayudándolos. Algunos no saben ni leer ni escribir, pero con todo el respeto que usted me merece, estamos reunidos aquí más que todo para pedir ayuda y buscamos la posibilidad de poder obtener un seguro médico para todas las personas de la comunidad que no cuentan con un seguro. Es muy difícil para todas las personas de la comunidad que algunas veces no van al médico por miedo de no ser atendidos por no tener su seguro médico.
Hi, good morning to all of you. My name is Rocío Ontiveros. I live in Lewiston and I love the state of Maine, and I've been working with the Hispanic community, supporting them, people who don't have health insurance for many years. But with all due respect, we're here today to ask for your help. We are seeking the possibility to obtain health insurance for all of the people in the community that do not have access to health insurance. It's very difficult for all the people in the community that many times do not go to the doctor out of fear of not being attended to because of lack of ability to pay.
Hay una organización que brinda servicio médico, pero desgraciadamente no cubre todas las necesidades de los pacientes. Algunas veces se busca free care cuando la persona tiene una urgencia grave, pero esto les resulta muy complicado porque la respuesta de las organizaciones son muy pocas o muy lentas. Y las personas no son atendidas hasta que el médico está seguro de que la consulta va a ser cubierta económicamente.
There is an organization that offers medical services, but unfortunately, they only cover part of the patient's necessary care. Sometimes one looks for free care when someone has a severe emergency, but this becomes very complicated because the response from the organizations are slow, and the people cannot receive treatment until the healthcare providers are sure that the consult will be financially covered.
Es muy triste y frustrante y desalentador para los pacientes que esperan una respuesta de estas organizaciones. Tenemos historias de varias personas que tuvieron quebraduras y por no tener su seguro médico están sufriendo dolores de su cuerpo, pues eso ya será durante toda su vida, porque esas quebraduras nunca fueron sanadas por falta de servicio médico. En las lecherías han sido aplastados por las vacas y no han tenido buena atención, no han tenido sus terapias, entonces ellos van a continuar teniendo sus dolores por toda su vida. Es muy triste, es muy frustrante, pero sabemos que con su ayuda lo podemos lograr. Estamos confiados en que usted pueda ayudarnos.
It's very sad and frustrating and discouraging for the patients who must wait for a response. We have many stories of people who have broken bones, and because of not having access to health insurance, they have not sought the necessary therapies needed, and the pain they experience is constant. At dairy farms, many people have been crushed by cows, and they will never be able to make a full recovery. I trust in you, and I think with your help, we can win this.
Sabemos que sería una aportación de nuestra parte, de toda la comunidad hacia la economía, pudiendo tener un seguro médico. Agradecemos por su atención. Le agradezco mucho que haya tenido que me haya regalado ese espacio para poder expresar las diferentes situaciones de nuestra comunidad. Espero que su ayuda y espero que todas las personas entiendan nuestra situación.
This would also be a great economic contribution to the state of Maine. Thank you for your attention and thank you for granting me the time to express myself. Thank you.
Thank you for being here. Are there any questions of for this testimony? Yes, Representative Craven.
Thank you. I don't have any questions. I just wanted to thank Rosa for coming and let her know that I'm from Lewiston as well. And it's great to have such a great, rich population in Maine. And it's great fun today to just hear everybody's input. So thank you.
Le agradece mucho por sus comentarios. Y es de Lewiston también.
Oh.
I just wanted to remind folks that we can take printed testimony right up until we vote, and several folks have not submitted that. That's fine, but if you wanted to see the printed version, we'd be glad to see it. I think the committee would appreciate the English translation version. I can't do Spanish. All right, thank you all for being here. Buenos dias. Now we'll hear from Ms. Sprague.
Good morning, Senator Claxton, Representative Meyer, and distinguished members of the Joint Standing Committee on Health and Human Services. My name is not Dusty Holman Sprague. My name is Lane Gregory, and I'm on the board of the Maine Women's Lobby. And I'm representing Dusty here this morning as she is testifying on, I think, 5 other bills today, and is to stand in her stead.
Thank you.
I join with you today on behalf of the Maine Women's Lobby. For over 40 years, the lobby has advocated for public policy which increases the health, wellness, economic security of Maine women and girls, with a focus on the most marginalized populations and communities. We write today in support of LD 718, and I won't go into the name of the act because you've heard it many times, but we really wanted to not only endorse this LD 718, but we also want to thank Representative Rachel Talbot Ross for sponsoring this very important bill. Thank you, Rachel. As an organization founded on the idea of ending discrimination, we support policies that ensure that Mainers will not be discriminated against on the basis of gender, sexual orientation, race, ethnicity, age, ability, or religion. LD 718 seeks Maine's discriminatory practice of excluding immigrants from accessing healthcare through MaineCare and CHIP. And we hope you will join us in supporting this vital. MaineCare keeps people alive. In an environment where employment is the primary means to healthcare access, MaineCare creates a path to coverage for Mainers unemployed, underemployed, and those who can't access employment due to needs related to health, mental health, disability, caregiving obligations, or other circumstances. Women are less likely to be insured in Maine, and women and children are significantly more likely to live without income security and therefore to qualify for programs. The current policy to exclude immigrant Mainers from these programs disproportionately affects women and children, and in fact exacerbates the inequities that women face, as lack of health coverage is a contributor to poverty. We believe that healthcare is a human right, but it's important to note injustice works in ways that we aren't always looking for. Since the expansion of MaineCare in early 2019, more Mainers than ever have before can access life-saving health supports, such as substance abuse treatment, emergency care, and preventative care. It's time to re-extend this coverage to our immigrant friends, families, and community members, and ensure that every Mainer has the healthcare coverage they need to thrive. We hope you will vote ought to pass on LD 718. Thank you very much.
Thank you for bringing that testimony. Are there any questions? I don't see any. Next, we'll hear from, looks like Oliveira.
Oliveira, yes.
Welcome.
Thank you. Senator Claxton, Senator Meyer, and the members of the Community and Health Service. My name is Flavia Oliveira. I am a resident of Waterville and a city council, a parent of school-aged children, and an alumni of the Parent Ambassador Program. I'm here today to testify in favor of LD 718 because I believe that healthcare is a human right. In 2016, I collected signature at the polls to expand healthcare. I knew so many low-income people were struggling without healthcare then. They were getting sick because they couldn't afford healthcare and then ending up at the emergency room. We were so happy and a huge number of Mainers came together to pass healthcare expansion. Maine people understand that we need more healthcare and not less. Little did we know at the time that we would face such a huge healthcare crisis as we did last year. If this pandemic had taught us anything, is that life is scarce and that we are all connected. The healthcare of one of our community members really does affect us all, and sick and in health. With Maine Care expansion efforts covers tens and thousands of low-income Mainers, and we see that people who need healthcare can't afford it and have been left out. Like they have been left out because of the broken immigration system. With no options, they end up at the emergency room or worse. We cannot rest until all income residents have the health care they need. Immigrants contribute so much to the life and overall health of our community as public servants, community leaders, healthcare and hospital workers, farmers workers, getting healthy food to our table, and healthcare workers caring for our elderlies. It is not right that some never see the return of the investments they make as a resident and work here in Maine. Immigrants contribute tens of millions to a tax revenue each year. They pay in the system and they should have access to public benefits provided by the system. Every Maine resident needs and deserves the health care. My husband, he's an immigrant and needed help with mental health needs. But unfortunately, because healthcare is not accessible to him, his condition got a lot worse and caused a lot of barriers to our family. Please vote on LD 1718 and complete the work that we did expanding Maine Care. Thank you for your time and your attention. Thank you.
Thank you for your testimony. I think we'll take a 5-minute break at this point. I'm sorry, Representative Madigan has a question.
Not a question. I just wanted to welcome my friend and constituent, Flavia. She's a rock star.
Thank you.
Okay, so why don't we take a 5-minute break? We'll come back at 11:22 and resume hearing from these testimonies, starting with Rastanpur. Thank you. See you in about 5 minutes. So we can get started again. I will ask Gomri Rostampur to unmute and join us at your when you're ready.
I am ready. I unmuted.
You're unmuted. Now you're muted. We just can't see you.
Muted. Start my video.
There we go.
Good morning, and thanks for giving this opportunity to me to talk. Senator Clarkson and Representative Meir and honorable members of the Joint Standing Committee on Health and Human Services. My name is Gomri Rastampur. I live in South Portland City, and I am here today to testify in favor of LD 718. I would like to tell you, I would like to let you know, this is not my story. I work as a civic activist and as a committee member of Opportunity Alliance. I work with asylum seekers, refugees, immigrants, trying to get them health care and many more benefits. For example, there is an Afghan woman I have interpreted for who had 2 sons who both died in US Army because they did interpreting for US Army. So those people are dying for us and protecting our soldiers overseas. But unfortunately, their mom has been here since 2014, and she still doesn't have her citizenship, green card, or healthcare, even a simple state ID card. They didn't give even a simple state ID card to her. I got her permission to share this story with you, and if you would like more details, I can forward her information. I have more stories like this of children who grew up here who haven't even completing their school without healthcare. So LD 718 is very important, and supporting LD 718 is supporting our community. Thank you so very much.
And thank you for your testimony. Are there any questions to be asked? I don't see any. So now we can go to Ms. Ahmed.
Hi, thank you for giving me this opportunity. Senator Clark, Representative Mayor, and Honorable Member of the Joint Committee on Health and Human Services. My name is Hamda, and I'm a resident of Lewiston. I work at New Mena Public Health Initiative as a program manager, and it's an ethnic-based organization located in Lewiston, Maine. I'm here today to support the LD 718. When I came to this country in 2013 as an asylum seeker, I was only 19 years old, looking for a better future without living under the fear of a dictatorship system in Djibouti. I started to learn the language here and to volunteer in many places, such as Trinity Jubilee Center, Maine Immigrant and Refugee Services, and also the place that I currently work, New Mena Public Health Initiative, to assist the community that were facing the same problem as me. For example, not being eligible to work, food and housing needs, language and cultural barriers. After 1 year of being in the United States, I was eligible for a full Maine care because I was granted asylee. I was eligible for the full Maine care since I was under 21 years old, and I started a part-time job and enrolled to the community college as well. With my Maine care, I had the opportunity to receive a dental care and a vision care that I really needed at that time. Sadly, when I turned 21 and I was still a student without a stable job, I lost my health assurance. Since then, I live under the pressure and the fear of getting sick or getting hospitalized without having enough income. Now that I work mostly with the asylum seekers population, I see the same needs still exist within the community. For example, when while the pandemic, with the gift card that we distributed for the low-income families, some of them were using to purchase insulin and other medication. Their health assurance was not covering. So this bill will make a huge difference for those families that are struggling with many other issues, and healthcare is one of them.
30 seconds.
I'm asking this committee today to vote in favor for the LD 718 to make a lot of people safer. Thank you very much.
And thank you for being here. Thank you for your testimony. I don't see any questions. So we'll go to Mr. Ngoy. If you want to unmute yourself, sir. I saw you earlier. There we are.
Hello.
Hello, go right ahead when you're ready.
Hi, Senator Claxton, Representative Mayor, and honorable members of the Joint Standing Committee on Health and Human Services. My name is Henok Ngoy. I work with New Manners Public Health Initiative as a community health worker. I live in Lewiston, Maine, and I am here today to testify in favor of LD 718. As a community health workers, we are frontline public health workers that educate, advocate, and empower community members on a variety of health and link them to available community resources and healthcare programs. I arrived in Maine in 2018, looking for personal safety from Africa, the Democratic Republic of Congo, the country where I experienced persecution. I had applied for free health care at the HHS. My request was rejected. Luckily for me, St. Mary's Hospital had granted me free care for 6 months. When I got the work permit, like I was working as a CNA, certified nursing assistant, in March 2020, I feel ill and my employer had demanded me to resign because of my illness continued, and it took me 6 months without insurance. You can imagine how so exhausting and miserable it was. Since February 2021, our Congolese community has lost 2 young people, one in their 30s of age and another one in their 20s of age, who died in the interval of a month of sudden death. All this because the checkup is very expensive. I myself am a living testimony. For a simple checkup visit to the doctor, it generated 5 medical tests, twice all blood,
30
stool,
seconds, sir.
ultrasound, CT scan, and 4 times the visit to the doctor's office. Imagine, you know how much I have to pay in the interval between October and April. Medical prescription vitamin D only. The US is the world's biggest power, but healthcare is extremely expensive compared to countries like South Africa and even Zambia, where medical care is free from the poorest to the richest. We beg you, Honorable Committee, for the well-being and protection of all our neighbors and families of our states, please vote yes. I say, and I thank you.
Thank you for your testimony. I don't see any questions, but my condolences on the losses in your community. I'm sorry to hear about those deaths. So now we'll go to Ms. Ostrowski.
I can hear you.
Good morning, Senator Claxton, Representative Meyer, and esteemed members of the Committee on Health and Human Services. My name is Izzy Ostrowski, and I'm the Social Change Advocate at Preble Street, a human services anti-poverty agency with over a dozen programs and services provided across the state. I'm here today to testify in support of LD 718. At Preble Street, our programs work to meet the needs of people experiencing homelessness, food insecurity, and poverty. For the individuals and families we serve that are immigrants, it means also navigating the complexities of immigration status and a lack of access to resources. The trauma that the immigration system inflicts often affects mental health, physical health, and overall well-being. The Maine Medical Center Preble Street Learning Collaborative is one program that has long provided care to people without Maine care who we cannot successfully connect to other resources because of issues with insurance. This includes immigrants with mental health issues, dental care, as well as ongoing primary care needs. While this service is essential and invaluable, it cannot possibly meet the need of new Mainers who cannot access critical healthcare services. In addition to physical and mental health, a lack of adequate access to healthcare also affects every facet of life. Nicole, a new Mainer who has been living in Maine for 2 years, went almost the entire past 2 years with vision issues because she did not have access to health insurance and an eye doctor. Nicole experienced severe migraines, but without proper health coverage, she did not know whether her high blood pressure, sight issues, or neither were causing the migraines. Nicole's 8-year-old twin daughters also have trouble seeing, which has affected their learning and performance in school. Her daughters were diagnosed with sight issues last year through a clinic, but they are still waiting another 5 months to get an appointment with a doctor. This is the reality for so many immigrants in Maine, waiting and waiting for dire resources that may never come because of a lack of healthcare coverage. There are immigrants in Maine carrying the weight of homelessness, hunger, poverty, health issues, and immigration status, while simultaneously navigating language barriers and the stress of immigrating. This bill is a critical step in increasing access to healthcare and resources for new Mainers and working to end the disparities that currently exist. For this reason, Preble Street urgently asks you to vote in support of LD 718. Thank you.
Thank you. Are there any questions from Ms. Ostrowski? I don't see any. We'll go to Mr. Mayo.
Good morning, everyone. Thank you for having me. My name is James Mile. I'm a policy analyst at the Maine Center for Economic Policy, and MECEP is supporting LD 718 because all Mainers, including new Mainers, deserve access to affordable healthcare. What's more, we all benefit when more of our friends and neighbors have the healthcare they need. We've all spent the past year living through a public health crisis, a global pandemic that has starkly illustrated just how closely our health is dependent on the health of others. The COVID-19 pandemic has shown clearly that public health relies on the ability of all Mainers to secure access to affordable care in a timely manner. Thankfully, the legislature has taken steps to ensure that all Mainers could access COVID-19 testing and vaccinations at no out-of-pocket cost. But that same logic that the legislature has applied to COVID-19 applies to other infectious diseases, whether seasonal flu or something worse. Ensuring that vulnerable Mainers can afford to see their doctor, buy prescription medicines, and get vaccinated is something that benefits all of us. Research shows that Medicaid coverage comes with a huge number of benefits. These include greater access to healthcare, from preventative medicine to treatment for chronic diseases, but newly covered individuals also report themselves being in better overall health. Yet the effects go beyond health outcomes, however. Medicaid access has been shown to reduce poverty and provide more economic stability. Access to healthcare means less hunger, fewer evictions, and better credit scores as individuals' pocketbooks are no longer squeezed by rising medical costs. LD 718 would have similarly positive impacts on new Mainers' health and economic well-being. When all Mainers have the ability to thrive, our overall economy is stronger. Mainers have more money to spend at local businesses, and their improved health allows them to become more productive. The current policy of excluding some categories of immigrants from main care coverage leaves those individuals with few options. Due to their low income, they almost certainly cannot afford to purchase commercial insurance, and this leaves them only with the ability to receive charitable emergency care at a hospital. This safety net of last resort does help Mainers avoid the most serious consequences in the most dire health situations, but it does not allow them to afford preventative care, medical devices, or prescription medication. LD 718 is important to offer comprehensive healthcare options to these Mainers. Beyond the several hundred or so newly covered individuals, we know that LD 718 will also benefit members of their extended families. Lots of research shows that even when children are eligible for Medicaid coverage, they are much less likely to be enrolled in coverage if their parents are ineligible. Making sure that every member of a family can receive affordable health care is the best way to ensure that everyone who needs care has access. And finally, LD 718 will also help to benefit Maine's healthcare providers by reducing the reliance on charitable care, which comes out of which hospitals provide at their own cost. So in summary, I'd say 718 not only addresses a moral failing in the law, it also provides tangible benefits to our economy and society. I would urge you to vote ought to pass on LD 718, and I'm happy to answer any questions. Thank you.
Thank you, Mr. Mile. Are there any questions for him? I don't see any. So we'll go to Ms. McKella.
Good morning. My name is Jane Makala, and I live in Falmouth. I submit this testimony on behalf of the Maine Unitarian Universalist State Advocacy Network, reflecting our fundamental principle of justice, equity, and compassion in all human relations. There is no justice, equity, or compassion in a healthcare system set up to help low-income people, which then specifically excludes certain residents of our state for no reason other than their immigrant status. I'm a retired lawyer now providing pro bono legal services to asylum seekers and other immigrants struggling to get a foothold in this country. I know that other categories of immigrants also suffer under the current Maine care exclusions, but I speak to the plight of asylum seekers, most of whom cannot access Maine care until they actually receive a grant of asylum. I have witnessed how the complexity of the asylum process itself has magnified the harm to them from this exclusion. Preparing an asylum application that will meet the rigorous tests for asylum eligibility can require months of effort. And when the application can finally be filed, most end up in the enormous and growing backlog at the U.S. Citizenship and Immigration Services, USCIS, or an immigration court. The government does not publish data specific to Maine, but Immigrant Legal Advocacy Project estimates there are as many as 6,000 asylum seekers here in Maine. One of my pro bono clients filed her asylum application in 2014 and is still waiting almost 7 years later for the USCIS interview at which she can present her case. She now has health care through her employer, but many asylum seekers are not so lucky when they find work. Their health care needs go unattended. For them, there is no such thing as preventative care or screening, and treatment requires an emergency or finding a hospital whose free care policy deems their needs to be medically necessary. Imagine if you or your family faced those obstacles in trying to get medical attention. In almost all of our faith traditions, we are directed to welcome the stranger. Following that direction entails more than simply opening the door and saying, fend for yourself until you and your family have been here long enough to earn the same concern, consideration, and human dignity we accord to those not burdened by your immigration status. LD 718 would say, not only are you welcome, but we care that you can survive and thrive as you make your home here. Thank you.
Thank you for that testimony. Are there any questions for Ms. Makala? I think I got closer this time. I don't see any, so thank you for being here. And now we'll hear from Ms. Brown.
Good morning, Senator Claxton, Representative Meyer, and distinguished members of the Committee on Health and Human Services. My name is Julia Brown. I'm the Advocacy and Outreach Director at the Immigrant Legal Advocacy Project, or ILAP. ILAP means only statewide nonprofit provider of immigration law and related legal aid to Maine's low-income residents. On behalf of ILAP and our clients, I ask the committee to support LD 718. Not wishing to repeat the powerful testimony we have already heard, I will focus on a couple of points. First, the COVID-19 pandemic highlighted racial disparities in Maine. Researchers estimate that 1 out of 3 US COVID-19 deaths and 40% of US COVID-19 infections are linked to lack of insurance. Many of Maine's immigrants are Black and Brown, so restoring access to healthcare for all non-citizens is an urgent racial justice issue. Second, as immigration attorneys, we unfortunately see the negative impact that lack of access to healthcare has on our clients all too often. Many clients who have never had preventative care or screenings can only access healthcare when they have a serious medical emergency and end up in the emergency room. These medical emergencies and hospital visits have devastating impacts on their lives and their families, as you have heard about today. Clients could miss work or even lose their jobs. We've had clients miss ILAB appointments, which can delay their immigration case, and children have needed care while a parent is in the hospital. As the law stands now, families fleeing persecution and seeking asylum, green card holders who have held their green cards for less than 5 years, community members without immigration status, and some survivors of serious crimes, among many others, are ineligible for Maine care. Asylum seekers cannot legally work until sometimes years after arriving to this country, or perhaps even never under a new rule implemented last year in the Trump administration. But they cannot access healthcare even if they have no income. Or think about a permanent resident who has had a green card and been working and paying taxes for 4 years, who still is not eligible for Maine care. Or what about those Mainers without immigration status who work year in and year out, putting food on our tables, but who must delay life-saving care in fear of medical bankruptcy? Maine care saves lives and helps families stay healthy. We are all in this together. ILAP implores you to reverse the 2011 discriminatory decision and restore Maine care to our non-citizen neighbors, friends, and community members. Thank you.
Thank you for that testimony, Ms. Brown. I don't see questions, so now we'll hear from Julia Johnston.
Senator Claxton, Representative Meyer, and honorable members of the Joint Standing Committee on Health and Human Services. My name is Julia Johnston, and I live in Durham, and I'm here today to testify in favor of LD 718. I am a teacher at the Wayfinder schools, and I work with students, high school students that have not been successful in more traditional schools often because they have become young parents or bullying or any circumstances, various circumstances, including many immigrants. I believe that healthcare for my students is essential not only for their physical health, but also for their financial health, their mental health, and of course, their education. We pay a much higher cost by allowing health conditions to get worse and end up requiring emergency care than if they take care of them immediately when a small prescription would take care of the problem. This cost is not just financial. One of my students, and I don't mean to be too graphic, but I mean, one of my students did not have health care and found blood in his stool and had to continue to wait and did not take care of the problem, and then subsequently had to take several weeks off of work. And this is someone who has 3 children to be caring for. And so the cost is not only to him, but to his family as well.
Another had difficulty with the paperwork. The coverage therefore was not available, and a UTI became more serious. What we have to gain by providing healthcare to all is so much greater than what we would lose. Thank you for your attention, and I sincerely ask that you please vote yes on this bill so that my students can become successful, self-sufficient members of their community. Thank you.
Thank you for that testimony. Now we'll go to Kate Brogan.
Hi, can you see me? Can you
We
hear me?
can and hear you.
Yes. Hello, Senator Claxton, Representative Meyer, and members of the committee. My name is Kate Brogan. I live in Portland, and I'm here to urge you to support LD 718. My children are in 7th grade and 2nd grade in Portland Public Schools. They have friends and teammates and classmates whose families are from Kenya and Iraq and Serbia and Vietnam and Burundi and Guatemala and too many other places to count. Some of these families have become US citizens and others haven't. Regardless of their immigration status, these families are our neighbors. I listen to my kids talk to their friends, and I am so grateful that they are growing up in a community where it's just normal that people have different stories, different histories, different cultural backgrounds. I stand with their friends' parents on sidelines and on the playground, and I am ashamed that my government has chosen to deny their families the same access to healthcare that the rest of us enjoy, simply because they have arrived here on Wabanaki land more recently than those in power. These families are our neighbors. Their presence here in Maine is an enormous benefit to our communities and our states. We can't ignore the fact that a major factor driving the decision to limit Maine care 10 years ago is that Maine's immigrant communities are significantly more Black and brown than the general population of Maine. Many Mainers assume that racism and white supremacy aren't something we have to worry about here in the whitest state in the nation, and they are wrong. As the COVID pandemic has illuminated the extent to which inequities in healthcare affect communities of color in Maine, it is immoral for this legislature to continue this racist and xenophobic policy of denying Maine care to non-citizens. My ancestors arrived on this land as immigrants and colonizers nearly 400 years ago. I've lived in Maine for almost all of my life. What I know as a Mainer is that here we look out for each other. We take care of our neighbors when they're in need. These are my neighbors and they're your neighbors and they are in need. Please do what's right and give them access to Maine care.
Thank you, Ms. Brogan, for being here. I think now we'll go to Catherine Harvey.
Senator Claxton, Representative Mayer, and honorable members of the Joint Standing Committee on Health and Human Services. My name is Catherine Harvey. I live in Lewiston, and I'm here today to testify in favor of LD 718. I am a teacher, and I have several family members who are frontline workers, including working in nursing care and in home health. I'm here to testify in support of this motion because I believe healthcare is a human right. As a descendant of immigrants, I have been unable to transcend poverty and have lived in subsidized housing most of my life. I'm surrounded by working class people who are also the descendants of immigrants and who are immigrants themselves. The hardship here is ghastly. Yes, here in your backyard are children whose pants are too short, with coats that can't zip, whose parents can't receive dental work and are missing their teeth. Their family members are pulling money to purchase insulin, and many of whom cannot afford to go to the doctor. One day, I was standing at the bus stop and a mother told me that her child had been up all night with ear pain and a fever, and she didn't have any Tylenol in the house because she couldn't afford it. During this pandemic, the immigrant community was scapegoated and scolded for transmitting COVID, failing to realize that we are still living in the same conditions that your families did when they immigrated here from Canada. We are underhoused and our homes are full of bugs, inadequately heated, over 100 degrees in the summer. There's garbage in the streets. We are suffering from substance abuse and addiction, rocket high domestic violence rates, and a lead epidemic in our youth because of the slums that we're living in. We had nowhere to go, no time off, no ability to get cleaning supplies, and no one to care for our families. We weren't even sure we'd survive the hunger induced by closing schools. Access to medical care means a lot of things. It doesn't just mean regular physicals, access to insulin, or cancer screenings. It means treatment if you're raped. It means treatment if you're hit by an uninsured driver. It means treatment for domestic violence. It means access to mental health care. It means the control of communicable diseases and their transmission. It means lessening the effects of transgenerational trauma. And we know that easing the financial strain on families decreases suicide rates, crime, and domestic violence. Children
30
who come
seconds,
from
Ms. Harvey.
Thank you. Children who come from homes with less financial strain show higher success in their learning, ensuring a healthier, more successful generation. I asked the committee, does the aging majority white population of Maine know that without us immigrants, us Black and Brown, and yes, even Indigenous people from other lands, do they know that we cannot care for them if we are dead? Do they know that there will be no one doing in-home care, working in their nursing homes, caring for the disabled, cleaning their hospitals? Do they know that they depend on us? Do they know that we are going to work sick and harvesting and packing their food? We are valuable members of this community. The immigrant community deserves medical care, and you depend on our role in the community as well.
Thank you for your testimony, for being here, Ms. Harvey. Next, we'll go to Ms. Kilrain Del Rio.
Good morning, Senator Claxton, Representative Meyer, and members of the Health and Human Services Committee. My name is Kathy Kilrain Del Rio, and I'm the Director of Campaigns and Healthcare Advocacy for Maine Equal Justice, a nonprofit legal aid provider working with low-income Mainers to increase economic security, opportunity, and equity for people in Maine. Today, I'm submitting testimony in support of LD 718. An expecting mom who needs prenatal care, a young child with a health condition that could become life-threatening if untreated, an older person who needs to control their diabetes, a young man who needs mental health care. These are just some of the many examples of Mainers who I've been contacted about in the last 6 months because they are trying to find a way to get health care that is denied them due to their immigration status. As you've heard from many people today, immigrants from many different backgrounds and navigating different aspects of our complex immigration system are excluded from the Medicaid program due to harmful restrictions that were added in the 90s. They include immigrants of all ages across many parts of our workforce and in towns and cities across every part of our state. For many years and with bipartisan support, Maine continued to provide coverage for these immigrants until that coverage was abruptly ended in 2011. With that policy change, we forced many of our family, friends, neighbors, coworkers, and classmates who are immigrants to go without health care except when an issue becomes an emergency. This has led to poorer health conditions, harms academic success, affects workers' productivity, and most sadly, has led to earlier deaths. I've submitted longer testimony, but I'm going to just touch on a few points. The disparities we saw with COVID-19 helped shine a spotlight on some of the barriers to good health facing many immigrants in our communities. One clear policy solution that quickly arose was to ensure everyone who is income eligible can access Maine care regardless of their immigration status. LD 718 would make that solution a reality. The last year has reinforced what most of us already knew. Our lives and our health are deeply connected to the lives and health of everyone else in our community. It benefits us all to ensure everyone has access to health care. And quite simply, it's the right thing to do. Health coverage helps enable families to access needed care. It helps protect families from unaffordable expenses due to medical care and is critical for the health and development of children. Being uninsured leads to poorer quality of health care, lower rates of preventive care, and greater probability of death with uninsured adults. Uninsured adults are more than 25% more likely to die prematurely than those with insurance. There are many families with mixed statuses, meaning different family members may have a different immigration status to be U.S. citizens. It can be confusing and painful to have some family members be considered deserving of health care and others not considered deserving of health care. We know that when parents have access to coverage, children with coverage are more likely to see a doctor and get preventive care. Parents' health also impacts the well-being and financial stability of the entire family. As immigrants move through the immigration process or as laws and rules change at the federal level, their immigration status can change. And as their status change, they may become eligible for care that we then have to pay for. Lack of investment in healthcare now leads to higher costs for us all in the future. Immigrants from nations across the world have helped weave the fabric of our state. Those who are making their homes here today are bringing vitality, leadership, and economic growth to our state, just as immigrants have done throughout our history. Ensuring that immigrants have the healthcare they need to have a strong start here is an investment in Maine's future and the right thing to do. Access to healthcare for all Mainers who are immigrants will increase equity, strengthen their financial security, and result in healthier individuals, families, and communities. For these reasons and the many others you've heard today, we urge you to support LZ 718 and close these harmful gaps in our main care and CHIP programs. I'm also happy to answer any questions you have about the bill. Thank you.
I'm not seeing any questions, so we'll go to Ms. Hall. Thank you for being here.
Hi.
Hi.
Senator Claxton, Representative Meyer, and the honorable members of the Joint Standing Committee on Health and Human Services. My name is Krista Hall. I live in Portland, and I'm here to testify today in favor of LD 718. I'm a licensed clinical social worker, and I've been employed as the clinical director of Gateway Community Services for about the last 5 years. Gateway is a community mental health agency that was actually founded by a Somali refugee, and we are now the largest immigrant-owned mental health agency in the state. We bill out main care for our services, which means that we are unable to serve the asylum-seeking population, as they are typically ineligible for main care. At best, some might have emergency-only coverage. However, that does not provide any coverage for mental health. On a regular basis, I get inquiries from community members like teachers, school social workers, mentors, you name it. They all recognize that there is a desperate need for mental health support with this population. I am unfortunately unable to do anything about that. We cannot offer the coverage, even though our area of expertise is working with new Mainers. We have an agency full of culturally competent, trauma-informed, trained staff of case managers and counselors, none of whom can do anything to help support this population. We are turning people away on a near daily basis and have done for as long as Gateway has been open, and we've only seen the number of people we need to turn down increase. I supervise between 4 and 5 master social work students and interns every year. They do their very best to support the population. However, there are so many difficulties. They cannot access interpreters because we can't put them formally into our services, which main care would cover the interpreters. And some languages like Lingala, for example, don't exist anywhere in the translation app world. And at best, if you have someone who speaks Portuguese or French, you can cobble it together with Google Translate, and it often causes delays, miscommunications, and services not to be rendered in the most appropriate or the best way to meet the needs of the families. If this asylum-seeking population were to be able to receive full main care, then we could give them access to services like counseling and case management, formal interpretations. We are seeing so many requests right now for homeless asylum-seeking families, and their needs are trying to be met by a bunch of overworked people, mentors, volunteers, shelter staff. Case managers are adept at assisting people access the resources that they need. They're basically the experts of the social services systems.
30 seconds, Krista.
The longer that asylum seekers lack the full main care coverage, the longer they're going to be forced to navigate an unfamiliar system without help, and they must manage overwhelming trauma that impacts their daily functioning. Full main care would mean that this particularly vulnerable and underserved population would be able to better meet their basic needs, maintain good physical health, and they could seek to heal from their past hurts instead of adding more upon them. I urge everybody to vote to pass in favor of LD 718. I appreciate your time in hearing me today, and I'm happy to answer any questions.
Thank you, Ms. Hall. I think we'll go on to the next speaker and welcome, I apologize, Marcus Schuski. I can't hear. Yeah, you're still muted. You're still muted.
Hi. Thank you, Senator Claxton, Representative Meyer, and the honorable members of the Joint Standing Committee on Health and Human Services. Thank you for permitting me to speak on support of LD 718. My name is Lisa Markuszewski, and I work as a case manager at Greater Portland Family Promise. And we work with families, 90% of whom are asylum seekers, with obtaining housing, medical care, and access to education. When immigrants don't have access to main care, they have to go through an extremely complicated process in order to access any health care. This means applying for main care, getting denied, applying for free care, and then finding out where the gaps are in the system and how to get assistance in other ways. And caseworkers do this as part of their job. And even with experience doing this work, we find this system incredibly complicated and challenging. For immigrants already under enormous stress, navigating these healthcare challenges along with their other barriers make these complexities multiplied exponentially. When accessing healthcare is this complicated, it means that the healthcare system is inaccessible. It means that this current system is discriminating against a particular group of people, immigrants. And because the group of people, immigrants, are of color, it is racist. It is adversely affecting them. It is ableist. The system is just currently not set up to address this group, and they are denied access to healthcare. And people are put in life-threatening situations, which we see on a very regular basis, because either they can't get the care they need, or they're saddled with bills they can't pay. And Maine needs to do better. We are better than this. We are touted as a state that gives welcome and refuge to people and immigrants, and yet this old policy is discriminatory and racist and needs to be updated. And I support LD 718, my staff does, and we thank you for listening to us.
Thank you, Ms. Markuszewski. I knew better. I appreciate your being here. Then we'll go to Maria Woodbury.
Hello. Is my audio working? Okay.
It is.
Great, thank you. So I first want to thank everybody for the opportunity to speak today, and for those that brought the bill forward, speaking in favor of LD 718. I guess I'm a member of Southern Maine Workers Center as well as DICE Maine, and I'll be just kind of speaking about some experiences that I have seen and witnessed.
Ms. Woodbury,
unlivable
could I interrupt you to ask you to turn off your video? The audio is a little shaky right now, and I think if you turn off the video, we'll be able to understand you better. Thank you.
Okay, thank you. Let me know if this is not working.
That's better.
Great. So again, I'm speaking in favor of LD 718. Thank you again for the opportunity to speak. I wanted to say that Maine is unlivable for a lot of people. I've seen families flee from our state in the same way that they fled unlivable situations in other countries. That means leaving in the middle of the night. That means leaving all of their possessions behind and going to Canada, not telling anybody, not telling friends, neighbors, and family members. So as we want to consider ourselves a welcoming state and a safe place to live, that's not the case for a lot of people. People are leaving here, and I don't see or hear anybody talking about that, but I know many families that have had to flee in that way. I know somebody who has had no health care since coming here in 2016. This is somebody I met while working at the LL Bean warehouse, where, you know, for me, it was a part-time second job supplementing my income, but for folks trying to live off of those wages as their only source of income, it was not a livable situation. This person started a business in Maine, trying to improve the financial security and situation, and had no health care as a worker in LL Bean, also had no health care while, you know, running a business. That business had to shut down. due to racism in our system that's supported by our state government in the way that Logisticare and Midcoast Connector work with the businesses and contract with those companies that work with them. And so this person got a job at Abbott Labs during COVID-19. And Abbott Labs is a company that I've seen given a lot of support and thanks to because of their assistance in making tests for COVID-19. It certainly, I'm sure, helped people survive in this crisis. And yet Abbott Labs has a front door to their building that Black people are not allowed to enter. So people coming to work at 5 a.m. to start their shift are faced before they even get in the building with a security guard that will tell them to walk outside around the building and go into the back door. When white colleagues with the same level of experience, the same tenure, and the same job positions are allowed and welcome to walk into the front door of that building. That's in Westbrook, Maine. That is in 2021. So these are big issues everywhere that we look. This person had to leave the state.
Can we focus on the bill? We focus on the particulars of the bill.
Yeah.
Yes, I want to talk about how these issues of health and livability in Maine are interconnected. So this is the experience people face, and this bill would make a difference. This person has had to leave the state for work, all with no health care. Having health care in the state of Maine would make a huge difference for people. It would be one small thing that we can do to right the many, many wrongs that we inflict upon our neighbors, our friends, and our family members. And I do think that because the impact of COVID-19 has been disproportionate in its impact in people of color, any solutions that we propose must also help those communities disproportionately. We're damaging the relationships that we have with people that live here as our friends and neighbors and family members and coworkers. And we need to repair those relationships by making sure that the assistance we offer in response to this disproportionate negative impact assists the people who need it the most. And so I support LD 718 because I think it's going to make a big difference in just having basic needs met. Thank you for your time.
Thank you for your testimony. Now,
I would also like to raise a point of order briefly.
yes.
Just-
Actually, we're here to hear from you about
Thank you.
the bill.
As a point of order, I use they, the pronouns personally, and I would just recommend as a facilitation, not gendering folks and using Mr. or Mrs. or Ms. In referring to people by name, unless it's somebody that you know and you know how they would be referred to, just as a better general practice.
Thank you. We'll consider that and trying to figure out how to work that in our current circumstances.
Thank you.
Next, we'll go to someone else whose last name I'm going to mess up. Obam Sawin, would you care to join us?
Hi, can you hear me?
We can.
All right, Senator Claxton, Representative Meyer, members of the committee, thank you for the opportunity to speak. My name is Melanie Obamsawin, and I'm a member of the Wabanaki community. I'm from Western Maine. I'm the president of Bombazine Land Trust, which is a Wabanaki-led nonprofit for food sovereignty and environmental justice in our homelands. I also work for Racial Equity and Justice Org and Sunlight Media Collective, and I'm testifying in support of LD 718 and in solidarity with poor and immigrant communities in Maine. It has never been more clear how critical healthcare access is to the well-being of the public. During this pandemic, many wealthy and privileged people have been forced to see that their own well-being is dependent on that of the underprivileged, a fact that may have been easier to ignore before COVID-19. COVID has been a reminder of how unjust and dysfunctional the public health system can be and how unprepared it was for a catastrophe of this magnitude. Our immigrant communities are a barometer for racism in public health. Many in the immigrant community fear or avoid going to the doctor, as we've heard today, when they are sick because it could put their family at risk for deportation, let alone for lack of insurance coverage. This is an injustice. Studies show that preventative care Early access to healthcare before illness and conditions turn into an emergency is cost-effective for the healthcare system and in the long run. It makes the system more sustainable. With a healthy society, the nation will be able to reopen sooner and with a healthy workforce. Expanding main care to everyone, especially essential workers, is good for the future. But it pains me that we have to make an economic argument to get through to lawmakers because these communities are so exploited in the American economy as is, and their value as humans is so much deeper than their contribution to the US economy. I think we can learn a lot about public health needs from our failures and successes during this pandemic. I got vaccinated 2 weeks ago. It was free for everyone, with people in highest need having access first. And there were no questions asked, no complicated runarounds with insurance companies, no copays, no nationality or immigration status questions. This will continue until everyone is vaccinated, until everyone is safe. This is what an equitable, functioning healthcare system looks like. I want to close by saying that healthcare access is absolutely a matter of racial justice. After the shootings in Atlanta and Minneapolis in the last 2 weeks, a lot of people are proclaiming that they stand with Asian and Black communities. With kids still in cages in the Southwest, there are a lot of people proclaiming that they stand in solidarity with immigrant families. In response to the murder of Dante Wright by law enforcement, there are a lot of people in power right now, people who make the laws, who want us to believe that you think Black lives matter. Many of Maine's immigrants are from the Black African community. You can prove your commitment to these communities by expanding Maine care to them. Thank you.
Thank you for your testimony.
We've been listened to since 10 o'clock.
And now we'll go to Marfine Chan.
Thank you, Chair Claxton, Chair Mayer, and members of the Health and Human Services Committee. Thank you for taking the time to listen and engaging in a dialogue on how we can make Maine more just and equitable for all. My name is Marfine Chan, and I'm here as president of the Cambodian Community Association of Maine to support LD 718, sponsored by Assistant House Majority Leader Rachel Talbot Ross. Since the beginning of the pandemic, the Cambodian Community Association of Maine has helped a dozen or so Cambodian Mainers apply for Maine Care and the CHIP program. Just a dozen isn't great, especially when you take into account that we've assisted over 240 families representing over 800 individuals, including over 200 children under the age of 18. The current census figures show that Cambodians are about 1,900 strong in Maine. What that number tells me is that there are many who have fallen through the cracks of a broken system that vilifies and scapegoats immigrant Mainers who make up a large part of our frontline, essential, and service industries, and who contribute nearly $500 million in tax revenue to the state and federal government. The Cambodian community, since arriving in Maine, has played an outsized role in Maine's key industries, from healthcare to seafood processing. Many are working more than one job to help make ends meet. In addition, many Cambodian Mainers have experienced tremendous trauma because of the Cambodian genocide, where they saw 2 million of their fathers, mothers, brothers, sisters, friends, and neighbors murdered by the Khmer Rouge. Is it moral and is it just to inflict further trauma on them through discriminatory and exclusionary policies that bar them from accessing healthcare? This isn't about handouts or even a hand up. This is about closing gaps in our healthcare system and how we as Mainers can walk hand in hand together toward a more just and equitable Maine. I urge members of this committee to support LD 718. Thank you.
Thank you, sir, for being here. Next, we'll go to Ms. Hannon.
Good afternoon. Senator Claxton, Representative Meyer, ladies and gentlemen, the Joint Committee on Health and Human Services, and Representative Talbot Ross. I'm Megan Hannon, Executive Director of Maine Community Action Partnership, and we support LD 718. I use she, her pronouns and refer to myself as Ms. Thank you for your patience today. For more than 50 years, Community Action has served as a dynamic and community-based force in addressing the causes and conditions of poverty throughout Maine and the country. Our 10 community action agencies deliver programs and services to people with low and moderate income, including the HEAP program, workforce development, current rental relief program, Head Start, and more. York County Agency also includes a federally qualified health center. Equity in health, education, and economic opportunity is a keystone of our mission and our work. We are focused on ending the systems and policies that allow or even encourage racist outcomes. I'm sorry to say, and you've heard several times, this bill is necessary because until 2011, the state of Maine did offer Maine care to all income eligible Mainers, regardless of immigrant status. It was changed largely due to wrong-headed beliefs about who immigrants are, what they do not into Maine. I personally had several uncomfortable conversations with the previous administration about HIV and AIDS, previous less deadly avian flu pandemic, and other health issues wrongly attributed to immigrants. The current pandemic and its racist origin theories show the misunderstanding about disease and illness continues. The actual numbers of those who became infected with and ill from COVID-19, the most population disparate number in the country, show that we need everyone to have access to healthcare. Access to healthcare is one of the several building blocks to success. All who live in Maine, regardless of their immigration status or even their time in the state, need and deserve access to safe, affordable housing, education, good jobs, and economic opportunity. And to meet those things, need health and healthcare. Healthcare is a necessity, not a luxury. So I ask your support of LD 718. I'm happy to answer any questions I can.
Thank you for being here. I don't see any questions, so we'll go to Mia Dyson. So it looks like you're not unmuted yet, and we can't see you yet. There's the unmuted part.
All right.
We can hear you.
Oh, there we are.
There we are.
Okay. Good morning, or I should say good afternoon, Senator Claxton and Representative Michelle Meyer and members of the Health and Human Services Committee. I'm the Reverend Mia Dyson. I pastor a congregation in Wales, Maine. I also work as a registered nurse in labor and delivery at Maine Medical Center. I come before you today to voice my strong support of LD 718, sponsored by Representative Rachel Talbot Ross. Both in my work as a spiritual leader and in my work in bedside nursing, I see the wealth of skills, wisdom, energy, and compassion that our immigrant communities bring to Maine. Immigrants play a vital role in the future growth and vitality of our state, and yet we currently deprive them of access to Maine care, weakening their ability to live and work to their fullest potential, or worse, condemning them to live with chronic disease and pain, or even to die from treatable causes. I have a friend whom I will call Renee. She is a married woman was a married woman in Congo, raising a family and working as a social worker. Her work focused on girls and women who had been raped as a form of political torture and who bore children conceived in that violence. These women were ostracized from their communities and lived in poverty and danger. Renee herself was targeted by warring political forces, and she faced immediate threats to her own life. She fled the country and, after a harrowing journey, arrived in Portland, Maine. Renee suffers from severe PTSD. She has chronic pain and difficulty ambulating. She weeps every day for her husband and children, a gifted, compassionate person in need of healing in so many levels. She is the face of our immigrant community who desperately need access to health care now. In 2011, as the previous speakers mentioned, the LePage administration reversed Maine's longstanding commitment not to discriminate against immigrants, cutting approximately 500 people like Renee from the Maine care rolls. In 2017, Maine voters resoundingly supported Maine care expansion. Now, Maine care expansion is delivering critical, affordable care for more than 70,000 Mainers during this pandemic. With LD 718, Maine can close another gap in our healthcare system, offering Maine care to our esteemed immigrant community. Friends, healthcare is a human right. Please support this important bill and bring us a step closer to offering healthcare to everybody. I thank you.
And thank you for being here. I don't see any questions, so we'll go to Michael Mosley.
Hello and good afternoon, Senator Claxton, Rep. Meyer, and the members of the Health and Human Services Committee. My name is Michael Mosley. I'm here today to speak in support of LD 718. I am a resident of Waterville, and I've been a hotel manager here about 7 years. That job has given me a sort of stability that I wasn't able to get anywhere else. And because of that, I now sit on a board of a nonprofit. I work with people in my community. I help parents at the local preschool. And that opportunity wasn't given to me by a citizen of America. It was given to me by an immigrant and an immigrant family that took me in and was willing to give me that chance. And it hasn't been easy. I have kicked and clawed and scratched my way to being somewhat successful in life. And the only reason that I was able to do that is because I was able to lean on things like main care, because that was available to me, because I have that access. And there are times over the last few years where, for instance, I got walking pneumonia. Went from being completely fine that morning to barely being able to breathe that night. And if I didn't have main care, I wouldn't have gone to the hospital. I just wouldn't have, because I couldn't have afforded that bill. But my pneumonia was serious. And it pains me and it angers me, the fact that the difference between me and one of my housekeepers or one of my other employees is that I get to go to the hospital, get medicine, be out of work for a day, and then go back. But they would have to make that decision that I would have made if I didn't have main care, which is to just tough it out, maybe lose a week of work, maybe not make it through that pneumonia because that pneumonia was serious. And the idea that we have a system which allows this to happen to people on a regular basis just because they aren't from this country is insane. I don't think it's conscionable. I don't think it's conscionable on any level. And I can't imagine that our government would sit here with this bill in front of them and say that we can continue that system.
30 seconds.
I don't even need that 30 seconds because I've already said my piece, and I think that you ought to vote ought to pass.
Thank you. Not seeing questions, we'll go to Muhammad Ibrahim.
Hello, good afternoon, everyone. Good afternoon, Senator Claxton, Representative Mayor, and honorable members of the Joint Standing Committee on Health and Human Services. My name is Mohammed Ibrahim, and I am an organizer for Maine People's Alliance. I live in Auburn, and I'm here today to testify in favor of LD 718. MPA is Maine's largest community action organization with over 32,000 members across the state. Our mission is to create a world where everyone has what they need, contributes what they can, and no one is left behind. In addition to being an organizer with MPA, I'm also a new Mainer. In 2012, I fled political persecution from Djibouti and sought asylum here in Maine. What I did not know when I arrived was that the year before, in a major departure from Maine's longstanding commitment to not discriminate against immigrants, the LePage administration reversed the policy, cutting health care for hundreds of new Mainers, including asylum seekers like me. LePage reversal forced asylum seekers like me into an enviable situation and conditions. Under federal law, we are barred from working for 150 days as asylum seekers after we apply for asylum, and that is the minimum time that it takes. That makes it impossible to afford medical care. Then we are barred from using programs like Main Care and cheap living as no way to get access to health care. Thank God that I didn't get sick in the long months when I was caught in medical limbo. But not everyone is lucky. I have heard countless stories from other new mainers who have medical conditions, but who are barred from accessing medical care. It's an incredibly cruel policy that undoubtedly has cost lives and has helped lead to record racial disparities in Maine COVID infection rates. One thing that this pandemic has taught us all is that we are only as healthy as the least healthy amongst us. When we deny anyone access to medical care based on their immigration status, we're making our whole society sicker. I urge you to reverse the injustice and vote for LD 718. Thank you.
Thank you for your testimony. There's probably a comment from Representative Craven.
Thank you, Mr. Chair. I just wanted to say hello to Mohammed and good job. Nice to see you.
Hello, Margaret. Good to see you.
Okay. Next, we'll go to Elizabeth Barada. Welcome.
Hello, Chairs Claxton, Meyer, honorable representatives, members of the Joint Standing Committee on Health and Human Services, and sponsoring representative Rachel Talbot Ross. I'm Beth Barada. I'm a resident of Bangor, and I'm here to testify in favor of LD 718, and I would like to speak as an outpatient family medicine physician. There's a discrepancy in health outcomes based on financial resources, but this health inequity is due to more than just money. Being poor limits your general level of education and access to skilled jobs. An unskilled position usually has minimal protected time off, limited insurance, and other benefits. It's not a secure job either. There's usually a large pool of similarly unqualified individuals who can replace you, often more desperate for income and thus more susceptible to being abused or mistreated to keep that position. With these kinds of jobs, getting time off for any doctor's appointment is something that can get you fired. These jobs are also more likely to expose you to toxic chemicals. For example, being in the laundry business, which uses organic solvents for dry cleaning, or being at a nail salon, which has volatile solutions that workers can inhale even with masks. Both of these places are places where those who are pregnant can be endangered. And these businesses have disproportionate numbers of non-citizens as employees. It puts their health at greater risk. It's also expensive to maintain good health. You need to be able to buy high quality food, be able to have vaccinations and screening procedures like colonoscopies, pap smears, etc., have regular dental visits, and know how to take your prescriptions. And it also means knowing when to see your PCP and when to seek an appropriate higher level of care, like going to the ER. But without insurance, these things are not affordable to a lower income population. Given the rising costs of healthcare, they're not affordable for the middle class out of pocket. But maybe most importantly, having an established PCP plays a tremendous role in maintaining good health. Yes, you need a PCP for the things I just listed, but practicing medicine is more than that. We aren't born knowing why ibuprofen should be taken with food, or reflux can be prevented by waiting several hours after eating before you go to sleep. I mean, that second thing I didn't even learn in medical school. This is something called health literacy, something overall impaired in the poor and underinsured. People can get their routine prescriptions and the like from emergency rooms, but it's expensive and it's not what they're designed for. ERs perform triage, where patients are prioritized according to their need for care and the benefit that care will provide. They determine if someone needs something to be done emergently and facilitate that something. It's not their job to spend time with them to determine what their actual job is. That's my job. I see my patients on more than one occasion and I build a relationship. I can help them figure out what matters to them. We can develop a plan that allows them to get the medical interventions they need. They can learn about their bodies and have their questions answered. They can be heard. What they're doing well can be reflected back to them, and what they're struggling with can be transformed into action or growth. A big understanding of health is understanding your body, how it functions, and to know when to worry, when to sit with discomfort and wait it out. But the uninsured mostly just have access to someone who can tell them that they're not having a heart attack or they don't need surgery for appendicitis. And this is doing them a great disservice. Thank you.
Thank you for that testimony. I see a question from Ms. Withy.
Sorry, Senator Claxton, it's not a question. It's actually for you. I just wanted to let you know that you're being called to go into HCIFS.
Okay. So at this point, I'll turn it over to Representative Meyer, and she can take over the chair. All
Thank you,
set for
Mr.
that?
Chair. Yes.
Thank you.
Okay, so thank you, Carrie. Up next is Mufalo Cheetah. Welcome.
Thank you. My internet is unstable, so just in case I go out, and I've submitted my testimony as well.
Thank you.
Thank you.
It may work a little bit better if you put your video off, and then your audio won't be unstable.
Okay.
There you go.
Thank you. My name is Mufalo Chitam, and I'm the Executive Director for the Maine Immigrant Rights Coalition, and I'm here to testify in support of 718. On behalf of the Maine Immigrant Rights Coalition, a coalition with a commitment to advancing and defending the rights of immigrants. I'm going to give you some stats. The population growth in the last 10 years has come from people from away. The Maine Kids Count 2021 report states that in the early 2000s, Maine led the country with the low rates of infant mortality. But in 2011, as you've heard, the LaPage administration reversed those policies. The report further states that for the period of 2011 to 2016, the rate steadily increased to a high of 7 per 1,000 beds. In 2017, Mainers overwhelmingly voted to expand MaineCare. The report is also telling us that the period in 2019, 18, and
We're losing your audio.
Below the national rate of 5.7. Between 2015 and 2019, the rate of mortality rates for Black infants in Maine was 64% higher than the rate of the white infants. LD 718 closes remaining gaps in access to MaineCare for these infants in Maine. In the last 12 months, our community organizations have labored to educate our immigrant communities about COVID and vaccines, because they have internalized this discussion that they don't deserve access to healthcare because of their status. This bill will allow us as a community to have earnest discussions about healthcare with our immigrant communities. COVID-19 has shown us that the importance and the important impact of healthcare in one's life. So ensuring that our people have coverage should not be something that we should be debating now more than ever because of the pandemic. Healthcare is a right. It is a right. So I urge this committee to pass the bill. Thank you.
Thank you for your testimony. Questions from the committee? Seeing none, we'll move to Ronnie Flannery. Welcome.
Yeah, good afternoon, Representative Meyer and members of the Committee on Health and Human Services. Thank you for hearing us today. Many powerful stories have been shared with you, and I appreciate you listening to them and moving to action today. My name is Ronnie Flannery. I am a resident and child of Lewiston, the child of a Vietnamese refugee, and a staff organizer with the Southern Maine Worker Center. I'm here today to testify in favor of Representative Ross's LD 718. The Worker Center, if you don't know, is a member-led organization with a mission to improve the lives and working conditions for all people in Maine. We center on the human rights to healthcare and to work with dignity, and we know that these efforts are inextricably linked. Nothing has made more clear the flaws and the structural violence of our health system than the COVID-19 pandemic. But even before the pandemic, navigating health insurance options has been a near impossible task for migrant and immigrant workers. Our state has the opportunity today to begin to meaningfully respond to the heartbreaking fact that has been raised several times today, that in Maine, immigrant, migrant, Black, and POC workers have accounted for the most inequitable distribution of COVID-19 infection and death rates in the entire country. We must reckon with and address the culture of exclusion and inequity that had become the norm for MaineCare under the LePage administration. They deliberately removed coverage for those awaiting asylum decisions, for undocumented workers, and for green card holders that LD 718 will begin to repair. I want to underline too that inaction on healthcare justice has created a real and deeply felt culture of persecution and segregation for immigrant families across our state. These people are navigating frustration, hopelessness, fear, confusion about their healthcare, but still form the backbone of our most crucial industries, our leaders in our communities. They go to work for us every day to build a future for all of us. The immigrant workers have contributed more than $62 million in state and local taxes just in 2016. And we know that on average, immigrants who come to Maine are highly educated, highly skilled, far more likely to start businesses and create local jobs that benefit all of us. Healthcare is a human right, and that human right comes from our universal human needs. Like these immigrant workers, this healthcare solution is absolutely essential for Maine. It's time to move together from a culture of crisis and exclusion to care and justice. And we can do that today by supporting the passage of LD 718. Thank you for your time.
Thank you for your testimony. Seeing no hands up, we'll move to Sarah Calder. Welcome, Sarah.
Good afternoon, Representative Meyer. Dr. Beth Wilson was planning on testifying on behalf of Maine Health today, but was called away. So if you will indulge me, I will read her testimony. And I know it's been a long morning for you, so I will be brief. I'm Dr. Beth Wilson, Chair of Family Medicine at Maine Medical Center, and I'm here to testify in support of LD 718. I'm honored to speak about this important legislation and to follow the powerful testimony of so many others. As part of our mission of working together so Maine's communities are the healthiest in America, we're committed to providing access to healthcare services for all patients, regardless of their ability to pay or their immigration status. We provide free care to those at or below 200% of the federal poverty level, amounting to $25 million in the past year alone. While our health systems and clinics do not inquire a patient's immigration status, our providers come to know their patients and their stories. One of my colleagues cared for a child who had cerebral palsy and a seizure disorder. She was routinely admitted to the Barbara Bush Children's Hospital at Maine Medical Center due to these conditions. While her care in the hospital was covered by our free care policy, it was a challenge for our access to care team to obtain affordable medications and durable medical equipment for her post-discharge. If this child had been covered by MaineCare, we may have been able to improve her overall health and avoid these unnecessary hospitalizations. As a family physician, I hear stories from my patients about how they came to this country with nothing, having been forced to leave their belongings and loved ones behind. I see how hard they work just to make ends meet. I see the contributions they make to our communities, and I admire their resilience every day. And yet people who can't access or are denied coverage face impossible choices, avoiding or delaying healthcare simply because they don't have the money to pay for it. This is unacceptable and creates inequalities in health that we must address. As Representative Talbot Ross stated earlier, every Maine resident needs and deserves healthcare. So on behalf of the families and the communities we serve, we urge the committee to vote in support of LD 718, and I am happy to answer any questions that you may have.
Thank you, Ms. Calder. Questions for Sarah Calder? Seeing none, we appreciate you being here today.
Thank you.
Up next is Stephanie Eglinton. Welcome.
Thank you. And hello, Representative Meyer and members of the Committee on Health and Human Services and Representative Talbot Ross. Thank you for this opportunity. I'm Stephanie Eglinton, Executive Director of the Maine Children's Alliance. We're a statewide research and advocacy organization whose mission is to promote sound public policies to improve the lives of Maine children, youth, and families. And I offer testimony on behalf of the Maine Children's Alliance today in support of LD 17 to restore access to health insurance for hundreds of Maine residents with low incomes who have had their eligibility restricted due to immigration status. The coronavirus pandemic made it clear that when it comes to health, we are all interconnected. We all benefit and we're all healthier when everyone has access to care. I also just want to point out, similar to Mofalo's testimony, that policies such as this one are important to closing gaps to coverage because they improve the racial disparities that we have in Maine's health outcomes. So access to Maine Care and CHIP are critical in getting every child off to a healthy start. And that start begins before a child is born. The 2021 Maine Kids Count Data Book publication, which just came out, notes racial disparities in areas of maternal and child health, such as Department of Health and Human Services data by race about women who received prenatal care in the first trimester. So in 2019, Black women in Maine were less likely to benefit from prenatal care, 75% compared to 91% for white women received early care. So as you know, Maine immigrants are part of our families, our schools, our communities, and valuable contributors to our economy. During the COVID crisis, many put their own health on the lines while serving others as essential workers. It does not make sense that they should be denied access to Maine Care and CHIP. So as child advocates, the Maine Children's Alliance urges you to close this gap in coverage and support LD 718. Thank you.
Thank you for your testimony. Seeing no hands up with questions, we will move to Ambereen Rana. Welcome.
Good afternoon. Senator Claxton, Representative Meyer, and honorable members of the Joint Standing Committee on Health and Human Services. My name is Ambreen Rana. I use she and they pronouns. I live in Brewer, and I am here to testify in favor of LD 718. I myself am the child of immigrants. I've experienced and witnessed barriers to accessing healthcare myself, and I've seen it with my family. Today, I am sharing the story of a member of my community who could not join us on Zoom today. This is Sarah's story. Hello, my name is Sarah, and I'm from Central America. My partner and I fled our country from poverty and violence. We came to this country seeking a better life. Soon after we moved here, my partner and I realized that we did not qualify for medical insurance due to our legal status. We have 2 children together. Since my daughter was born in the US, she has medical care, while my son was born in my country, he does not. I was diagnosed with fibromyalgia a few years ago. I experience intense muscle pain in my feet and legs, my arms, and my back. There are days that my whole body hurts. I am not able to work because of the pain and fatigue that makes completing daily activities difficult. I also experience cognitive difficulties and mental fogginess. I have problems with memory, concentration, and organization. The chronic pain from this illness prevents me from enjoying life. It limits playing with my children or taking them to the park. I have free care from Maine Medical Center. However, this free care only covers doctor's visits. I do not have access to treatment for fibromyalgia, such as physical therapy or any kinds of therapies. I also suffer from depression because of the constant pain that I endure every day. My partner works 6 days a week, 12 hours a day to support us. He works cleaning offices. He recently started to experience pain in his feet, but he does not go to the doctor because he does not have medical insurance. He continues to go to work in pain. I know that his foot will get worse if he does not get the proper treatment. My older child was diagnosed with obesity, but because he does not have medical insurance, he cannot get the proper treatment that he needs. I have to explain to my son, who is 9 years old, that he cannot go to the doctor because of where he was born. And I have to explain that his sister has access to healthcare coverage because she was born in the USA. I urge you to support this bill because healthcare is a human right. Support this bill so that people like me with chronic conditions can seek medical treatment. Support this bill so that people like me with chronic medical conditions can seek treatment. Support this bill so other people in my community can seek medical treatment without the fear of how much it will cost. Thank you.
Thank you, Ms. Rana. Seeing no hands up with questions, we thank you for being here today. Up next is Claude Roganji.
Thank you.
Welcome.
Thank you. Thank you, Senator Claxton, Representative Mayer, Honorable Member of Health and Human Services Committee. Special thanks to Representative Tabitha Ross, who sponsored this bill. Thank you. My name is Claude Roganji. I am a Westbrook City Council at large and the founder and executive director of Prosperity Maine. My organization serves several immigrants, refugees, asylum seeker, and asylee, including low-income communities, with a basic education on financial and economic well-being. We can have a healthy community when we can provide a health coverage to some individuals. I am here to testify in support of LD 718, which will help to narrow the gap that we have in our society today. It's known to all of us that in 2020, Maine was the first state in a nation showing a highest number of disparities in COVID-19 by BIPOC communities, including immigrants. That's not a statistic that we all as men should be proud of. In fact, I was ashamed and also horrified when I saw this number nationwide, that we were, instead of being number one economically, we were number one backward. As my colleagues have already testified, this bill is in response to the existing gap. Once again, thank you to our representative for sponsoring this bill. As a former asylum seeker myself, I know how long this process can take. You heard from experts, legal experts, that it takes 7+ years to be able to receive eligible status as an immigrant and then have access to this human basic need. Many people during those times are really suffering as they don't have access to this issue. We need to support the immigrants community, as the immigrants are the backbone, the essential workers to our state if we want to build a strong economy. We cannot say that we need them as essential workers, but lack the way to support them with only these basic needs. That's contrary to what we can do as a community. As contrary to what many people have said in the past, or I continue to hear rumors, immigrants are not here to take away, but instead, they're here to help us build the economy. Again, as I said, as an asylum seeker, I myself have started an organization which today I'm proud to have hired
30 seconds.
Almost 10 employees, including some Americans ourselves. So let me say this. About 6 weeks ago, my own brother, who's an asylum seeker, was in the same situation that we heard today, that many people are fearing to go to hospital because they're not sure whether they will be covered under the Medicare or they will have coverage to cure them. So we need to prevent rather than cure, and that will cost less on our state than what we can continue to pay today. I urge you, please, to pass these human basic needs to our society. Thank you very much.
Thank you for your testimony today. Seeing no hands up, we will go to our final testimony today, and that is Nicole Clegg. Welcome.
Thank you. I'd love to say something clever about saving the best for last, but like having listened to all the testimony today, like I know that is not true. Good afternoon, everyone. Senator Claxton, Representative Meyer, members of the Joint Standing Committee on Health and Human Services. My name is Nicole Clegg, and I serve as the Senior Vice President of Public Affairs at Planned Parenthood of Northern New England. And I'm pleased to submit testimony in support of LD 718. In the interest of being brief and honestly to really pay tribute to the incredible stories and testimony that you've already heard today, I'm going to skip through pretty much everything that we have prepared. The only thing that I would just lift up is our experience as a healthcare provider. You know, what we have seen, especially in response to COVID-19 and job insecurity and the desperate need people have to equitable access to healthcare. And LD 718 is an example of policy that can help right a wrong that was committed about 10 years ago. So we, you know, firmly support this piece of legislation, believe that it's important for people's lives, and urge the committee to vote in favor. Thank you.
Thank you. Questions from the committee for Ms. Clegg? Seeing none, that concludes testimony on LD 718. We thank everybody for their words today and for being here with us. Does the committee have any requests for additional information or questions that our analyst, Aaron Dooling, may be able to answer for the work session? I am seeing none. With that, I will close the hearing on LD 7. Oh, go ahead, Representative Craven.
Thank you. Sorry, I was slow on the draw there.
No problem.
I would like to know if somebody is undocumented, if there's some kind of safety, some kind of safety for them as they seek medical care.
Okay. Anyone else? Seeing no hands up, the hearing on 718 is closed. We will take a break until 1:30 when we will return for LD 1282 and then move through our afternoon in the following order: 196, 197, 360, 415, and 582. With that, we will see you back here at 1:30.
in that account. The committee
We'll let a few more of our committee members return to the virtual horseshoe and get started. We'll be picking up with LD 1282. And we thank everyone for their patience as we are a bit behind today. So welcome back to the Joint Standing Committee on Health and Human Services. We will begin an afternoon of public hearings, starting with LD 1282, an act to prevent underage tobacco and nicotine access and use. And I'll remind everyone who's joining us that we will be hearing testimony in the following order: sponsor, any co-sponsors, and other legislators, those providing testimony in favor of the bill, then those opposing the bill, and then finally, those neither for nor against, but with additional information for the committee. We run a 3-minute clock on testimony and ask you receive, and letting you know you'll receive a prompt when you've got 30 seconds left, asking you to kindly bring your testimony to a close. Public hearings are just that for the public. The process of hearing testimony certainly encourages probing questions, and the committee is asked to use the raised hand function in order to ask those bill-related questions. So we'll open the public hearing on LD 1282. In the absence of this bill's sponsor, Representative Harrington, Representative Griffin will introduce the bill. So welcome, Representative Griffin.
Good afternoon. Thank you, Representative Meyer and Senator Claxton, and my fellow members of the HHS Committee. I'm Abigail Griffin, representing House District 102. I'm introducing LD 1282 for Representative Harrington by reading the summary of the bill. And it says, this bill amends the law governing the age of verification requirement for sales of tobacco products. It also establishes limits on the number of electronic nicotine delivery devices and nicotine liquid containers that may be sold in a single transaction. Thank you.
Thank you, Representative. So seeing no testimony in favor of LD 1282, we will begin with testimony in opposition to the LD. Welcome, Anthony Scott. Anthony Scott.
Yes, hello.
Good afternoon.
Good afternoon, committee members. Thank you for having me.
We can hear you, but there you go. Oh no, that's Brett Scott. And there's Anthony Scott. Okay.
I appreciate you all taking the time and the opportunity to address the committee. I sent written testimony in. Sorry, I just got back to my desk. I thought we were going to hear some people for the bill. So a couple of reasons I see to propose this legislation. It inconveniences Maine citizens, their personal freedoms to be able to purchase legal products. Many people are coming from rural parts of the state to acquire these products, and it makes it more difficult for them to obtain these as they are coming from a distance. Sometimes they like to stock up on bulk products. So I see it as an inconvenience for them to be able to stock up on them. The people that are doing this illegally are likely going to they would be able to go to multiple different stores to try to purchase these products to circumvent the law that you're proposing. Let's see, so it limits out-of-state revenue for small businesses in Maine. We count on the tourism business to generate revenue for the state and our businesses as well. So this is limiting us on sales. It's not helpful to small businesses. I'd also, I guess I'd like to talk about how this bill would be enforced. I know there's been talk before enforcement for tobacco laws, and you know, it's been a pain point to know whether or not these laws are being enforced to divert to enforcement on something like this that really can be circumvented by the underage or law, you know, citizens that are buying products for underage kids. If they can circumvent that anyway, shouldn't enforcement be towards that rather than towards, you know, business owners on limitations? I guess, let's see. I also have a question as far as the software goes. Is it a proprietary software that the bill is proposing as far as age verification systems, or are there multiple different softwares that are available to small businesses, or left to only use certain ones? Are they approved by the state? Are they vetted by the state? Another problem is the larger nicotine bottles that are proposed in the bill to be part of this. I believe
30 seconds, Anthony.
Yep. I believe those large nicotine bottles and larger devices aren't a problem with underage use. So to include them on this bill is really unreasonable, where it's kind of common knowledge that those haven't been a problem. I hope other people will talk. I wasn't expecting to talk so quickly here. I hope this helps. And if there's any questions, I'd be happy to answer them. Thank you.
Thank you for your testimony. Any questions for Mr. Scott? Seeing none, thank you for being here today. And up next is Brett Scott.
My name is Brett Scott. My whole family is in the business of smoke vape shops. Anthony's my cousin. He has a couple stores. I have a couple stores in Maine as well. I wanted to first just start by saying really who's behind this bill. This bill was initially proposed by Altria, which is big tobacco. They own Juul and they also own Marlboro cigarettes. The sponsor of this bill actually told us, he called us to say that he was going to be in support of actually killing this bill that he proposed. He didn't understand the impact they had on small businesses. I'd like to also express my concern. This is just another way that big tobacco is trying to squeeze the locally owned independent shops. And the explanation of how that is that Juul products are owned by big tobacco. They're in every convenience store. They're at every major intersection at convenience stores all across Maine, all across the country. You don't need to stock up on those products when you can just go to a convenience store. It's specialty stores that are destination, that people go to these destinations to actually purchase these products, and they buy more when they do that because it's a specialty store, it's a special trip. Juul is just another way to hurt the locally owned independent businesses, because all it's going to do is make it inconvenient to go to specialty shops. People are going to turn around, they're just going to go to the convenience store, they're going to buy the Juul device, the same one that caused all this vaping problem. It's not, this is a deceitful way for big tobacco to crush the little guy. They're doing it to us in a ton of different ways. This is not the only one. They're doing it through regulation, and that's how they're taking control of the market and hurting us little guys. Other than that, you know, I guess to vote no for this is representing the small businesses. To vote yes is helping big tobacco accomplish their agenda. So thank you.
Okay, thank you, Mr. Scott. Questions from the committee? Seeing none, we would welcome Graham Vinson. Mr. Vinson.
Thank you, Representative Meyer, Senator Claxton, and distinguished members of the Joint Standing Committee for the Health and Human Services Board. I am calling in today to discuss LD 1282. I can absolutely say that I am for limiting the supply of tobacco products to youth and for discussing and brainstorming ways in which we can do that. However, I do believe this bill misses the mark. In breaking this bill into two parts, one, my company does not and will not sell to minors. As I have testified before and met with you, I'm the father of 2 teenage girls, and I'm not in the business of allowing the access of tobacco products to underage youth. After numerous and continued age verification checks for my company and many like mine, we continue to ID anyone under the appearance of 35 and will always continue to do so. We are adamant about our age verification process. I've been in the business since 2015, and we have never once sold to underage youth, verified by the FDA's age verification checks. I believe the issue for underage youth stems from gas stations and grocery store retailers, not from specialized shops such as myself. 2, in limiting the quantity of products able to be sold. After hundreds of thousands of sales, the average person does not purchase more than what is being proposed in this bill. However, there are exceptions to that rules, such as couples that visit our stores together and are looking to purchase products. In that instance, this bill would make them purchase in 2 different transactions. And as the way the bill is worded, customers would still be able to make separate transactions to purchase what they are looking to get. Whether or not they are limited in what they are doing, this bill creates a customer and employee pain point that will only create frustration in having to ring up separate transactions. I also do not believe this bill is enforceable. How do we plan on tracking retailers keeping and using a scanning tool? How do we verify that retailers such as myself and others are limiting the sales to individual transactions? I'm not saying that I would not follow these rules and abide by them, but I don't see how we can ensure that everyone is playing by the rules. I think this bill is written for law-abiding retailers, creating further rules and regulations that we are already almost following. The retailers not following the current laws are the ones who will continue to break these proposed rules of this bill, doing nothing in essence to limit the supply of tobacco products to our youth. I can't say if I'm for or against this bill. I just know that there's got to be something else that we can do to limit the supply to our youth. Thanks for letting me speak.
Thanks for being here today. No, I see no hands up. So we will move on to Hillary Schneider. Welcome.
Good afternoon, Senator Claxton, Representative Meyer, and members of Health and Human Services Committee. As you know, my name is Hillary Schneider, and I cover government relations for Maine for the American Cancer Society Cancer Action Network. I know you've had a long day, so I'm going to keep it to the point. We do not support this bill because it is not evidence-based, and it treats e-cigarettes differently than other tobacco products. Maine law, federal law, and the FDA all define and treat e-cigarettes as tobacco products, so they should not be differentiated in retail law, in Maine law. So that is one of the reasons. The other thing, we have concerns over that the policy could instead lead to unintended consequences. The tobacco industry spends billions of dollars annually in point of sale marketing. In the marketing world, the term scarcity marketing is used to describe a marketing strategy used to influence consumer behavior by using the fear of a shortage or limited quantity available to drive the purchase of more units or impulse purchasing decisions. Since this is not an evidence-based strategy, there's no evidence that shows restricting the number of tobacco products sold in a single transaction would reduce tobacco use. We have concerns that the tobacco industry could actually use a mandated limit on the number of units per transaction to persuade purchasers who had originally intended to buy one device or liquid container into purchasing the maximum number allowable in a single transaction. In addition, as I believe a previous speaker said, there's nothing in this bill that prohibits a retailer from selling more products to the same individual through multiple transactions. We do appreciate the sponsor's intent to prevent underage tobacco access and use. This is a policy goal that we likely all support, but we encourage this committee to support evidence-based policies that achieve that goal, including increasing the price of all tobacco products through regular and significant tobacco tax increases, preserving Maine's strong, comprehensive smoke-free and tobacco-free policies, and closing the loopholes that exist in Maine law and those policies, adequately funding and implementing evidence-based tobacco prevention cessation programs, increasing access to evidence-based cessation treatments in Medicaid and private insurance plans, and reducing disparities in tobacco use through evidence-based policies like ending the sale of all flavored tobacco products, raising the price on all tobacco products, and adequate funding for targeted interventions. For these reasons, we urge you to vote not to pass on LD 1282.
Happy to answer any questions. Questions for Ms. Schneider? Seeing none, thank you for being here today. Thank you. Up next, Kelly Williger. Welcome. Kelly, you'll need to unmute yourself. We can see, there you go.
Can you hear me now? Oh, sorry, this is my first time.
That's quite all right.
Well, good morning. Hello, Senator Claxton and Chair Meyer and the rest of you. I'm happy to be here again. I know we don't have a lot of time, so I just want to be quick. I just had 2 rhetorical questions about the bill itself that I know will help you to make your decision. And then I wanted to give you a quick update on some of the things that have been going on in the vaping world with federal regulations. So first off, the 2 rhetorical questions I had, one Graham already asked you was how would this sort of thing be enforced? And my second question would be what sort of precedence is this sort of bill setting? You know, do you limit the amount of beer somebody could buy because they may have children in their homes? Do you limit how many bags of chips I could buy because I have high blood pressure? So those sort of things that sort of set precedents for limiting what consumers can make for decisions. And then to jump really quick, I wanted to let you know that in late December 2020, as part of that huge spending package, included in that was something called the PACT Act. So this is something that you all have been looking for over the years when we've met. The PACT Act has now limited all retail sales towards residential homes. So nobody can go online anymore and order a vaping product and have it sent to their home. This is going to be a huge, huge hurdle for our youth getting the product. As I've shown you before, I had charts and things from the FDA that showed that people were not buying the product in stores. Compliance checks had been done in Maine over the course of 3 years, and literally only 1 vape shop had failed 1 time. Other than that, it was all convenience stores and other small locations. So this PACT Act is already going to make a huge impact on youth being able to get access. It's even made it difficult for shops to get our products. We have to jump through a lot of hurdles to prove that we are actually a retail location to the distributors and wholesalers. So this is going to be really, really good in meeting some of those needs that we had in helping youth get access. A couple of studies that have been done most recently, because I know you're always interested in those recent studies. One done by Georgetown University Medical Center showed switching to e-cigarettes could save 6.6 million lives in the next 10 years. Why would we want to limit, somebody being able to buy a product that can save 6.6 million lives? That's huge. Also, per capita, a Progressive Policy Institute said that switching to e-cigs could lower healthcare costs. Just over 900,000 people ages 18 to 24 choosing to use e-cigs would save $11.3 billion in lifetime healthcare costs. I know that's something we're all concerned about as well. The Kansas University, California State, and San Marco University revealed that when smokers switched to non-combustibles like e-cigs, they were more likely to quit and experience healthier outcomes.
30 seconds, Kelly.
Sure. I just had one more that was really interesting to me, a study done by Lancet Respiratory Medicine, and it was funded by our National Health Institute and the FDA. And the findings said that the use of ENDS products with cigarette-like nicotine can reduce exposure to major pulmonary carcinogens, NNAL, I'm sure that means something to you guys, even with concurrent smoking. And that was available on 4/12. Thank you so much for listening.
Thank you for your testimony. Questions for Ms. Williger? Seeing none, we would welcome John Scher.
Thank you very much, Chairman Claxton, Chairwoman Meyer, and members of the committee. Good afternoon. My name is John Scher. I'm the Executive Director of the New England Convenience Store and Energy Marketers Association. Our members own and operate or supply, excuse me, the 954 convenience stores in Maine that employ over 15,000 people. Testifying today in opposition of LD 1282. Specifically, I'm opposing the section of the bill that would increase the minimum legal sales age to 30 years of age if a customer is unable or unwilling to present an ID card for scanning. Our opposition has nothing to do with any related expense or cost of required software for that purpose. In fact, there are a number of low-cost options and even a free app from the FDA that can accomplish it. Excuse me. Rather, we have two issues. First, access to Wi-Fi, some concern for rural stores. For these stores, the legal sales age immediately becomes 30 years of age. But more significant, however, is the confrontational and potentially dangerous position this policy would place our frontline clerks in when an adult customer who has not reached the age of 30 refuses to allow their ID to be scanned. I'm sure I don't need to tell the members of the committee how common it is for people to prefer not to have their movements or purchases tracked, and this is very much a privacy issue. The adults are legal. These adults that can buy these products are legal today. They can purchase adult tobacco products today, but not as soon. But as soon as this policy would be enacted, they would no longer be able to, or if they chose not to have their ID scanned. So imagine the anger, the frustration. Now imagine the interaction. The first time they are informed, they must either scan or be denied. We believe scanning actually is an excellent tool, and if used as a carrot, it can be very effective, rather than the stick that LD 1282 treats it as. According to the FDA, Maine has a 94, somebody alluded to this earlier, Maine has a 94% compliance rate statewide. This is a testament to the excellent work tobacco retailers do with age restriction. Fortunately, Maine has wonderful partners in the retailers that they license. So please don't put them in harm's way with this bill. And I would ask you to consider that as you consider other tobacco-related policies, that your retailers really are the front line. They are the gatekeepers for all of these products with 94% statewide FDA-verified compliance. Finally, please note I've submitted written testimony, but please note the portion of my written testimony that addresses the potential unintended consequence of Section 2, Paragraph B3, that may restrict PMTA authorized products, which the FDA, when it authorizes a product to receive a PMTA, to do so, it has to deem that product beneficial for the protection of public health. I fear that the way the language is written, it would exclude those products, and I don't think that's the intention of the bill nor Maine in general. Thank you very much, and happy to take any questions.
Questions from the committee for Mr. Scheer? Seeing none, thank you for being here today.
Thanks.
We would welcome Christopher Jackson. Mr. Jackson.
Good afternoon, Senator Claxton, representatives and members of Health and Human Services. My name again is Chris Jackson. I'm a resident of Shapley, Maine, and own several smoke and vape shops across the state. I try to keep this so it's not too redundant. Some other participants have touched on some of the things that I would like to touch upon. I just sat here for about 3 hours and listened to the last hearing on healthcare. I couldn't help but find very many parallels with low income, rural areas, restricting access to an affordable healthcare. This bill essentially is the same as far as restricting rural areas, which many of you represent, low income places, and it's very discriminative towards those people. We have many customers that come into our businesses from rural areas. Again, elderly people right now are fearful with COVID and the pandemic. So they don't want to come into our businesses twice a week. They want to limit their exposure. We want to limit our employees' exposures as much as possible. And so this bill essentially I find to be very reckless and insensitive to the pandemic that we're all fighting through right now. As small business owners, we've done everything that we can to stay open, provide products to adults. And essentially, this bill just, again, exposes everyone to the COVID even more than it already is. So some other people, again, have touched on this. This bill was brought to light by big tobacco. So essentially, you need to ask yourself, why would big tobacco want this? And I heard Mr. Scott already touch on that with It's basically the monopoly as far as they're in every gas station, convenience store. They're very readily available, not as readily available as products that a specialty store such as ours sells, essentially. I also heard someone touch on the fact of shortages or limitations create panic. I see no difference with that. And then say our Second Amendment stuff, such as ammo and guns right now. There's a buying frenzy. It creates panic. We don't want to see that right now. We want people to remain calm, frequent our stores, but frequent our stores as little as they need to and stock up while they can. This bill is intended to prevent underage purchases. Some other people already touched on the PACT Act. The PACT Act has already eliminated the fact that someone can, 18, 17 years old, stay at home, click a button, say they're 18 of age, and purchase a product. Our industry is under constant scrutiny and regulation. I ask that you do some of the regulations towards tobacco or put in the effort, which has been done to our vaping industry. There is no limits again on alcohol or tobacco products. And I just ask that everyone has a sit down and talk, and maybe have some of the professionals in this industry come in and speak with you and maybe bounce some ideas back and forth as far as what we can do to further prevent underage usage. Also, tax reform. We need to have a conversation about tax reform, because right now there's a 43% tax on these products, and it's making it more affordable to smoke a cigarette than it is to vape at this point. And that's not what we need right now. Again, all these parallels are with healthcare. I heard someone talk about the cost analysis with healthcare and the decline of tobacco combustible cigarettes being smoked, and that's a great point. Essentially, the less people that smoke cigarettes, combustibles, the less strain it is on our healthcare. And again, these are all just the parallels with that 3-hour conversation and hearing that we just heard.
Thank you, Mr. Jackson.
Thank
We
you.
appreciate your testimony. Questions for Mr. Jackson? Seeing none, we thank you for being here today.
Thank you.
Christine Cummings, welcome.
Good afternoon. Good afternoon, Senator Claxton, Representative Meyer, and members of the Committee on Health and Human Services. My name is Christine Cummings. I'm the Executive Director of the Maine Grocers and Food Producers Association. We are a trade group representing Maine's food community, Main Street businesses, including independently owned and operated grocery stores, supermarkets, food and beverage producers, processors, and our distribution partners. Maine wholesalers and retailers promote and embrace the responsible sales of licensed tobacco products. Retail strategies prevent tobacco use by underage youth, and they include due diligence such as staff training, in-store tools, and ongoing management. Maine retailers embrace the National Weed Card program, Maine's No Butts program, FDA tobacco training materials, and other training materials provided by wholesale and industry partners to reject underage tobacco purchase attempts. From all accounts, these safeguards are working. As in my submitted testimony, you'll see some similar statistics as noted from folks prior. MGFPA members and Maine tobacco retailers take their role in limiting youth's access to age-restricted products very seriously. The requirement for retailers to make a technology upgrade for the ability to scan a government-issued photographic identification using scanning technology or other automated software-based systems, as noted in LD 1282, has no implementation date, and the requirement would be effective 90 days post-special session adjournment. This is an unreasonable expectation that our independent grocery stores and other markets would have months to coordinate. We also question, as noted previously, whether or not the department has the ability to regulate this requirement. And as noted in testimony submitted by our partners at the Associated Grocers of New England, it is estimated that installing the scanning technology could cost anywhere from $500 to $15,000 per checkout lane. It is also unknown whether or not there is an adequate supply in the market to source, nor is this mandated financial burden acceptable to these stores who have worked tirelessly to keep Mainers fed. And we urge the committee to vote ought not to pass, and I'm happy to answer any questions. Thank you.
Thank you for being here today. Questions for Ms. Cummings? Seeing none.
Thank you.
We would welcome Laura Harper.
Great. Hello. Thank you very much. Senator Claxton, Representative Meyer, and members of the Joint Standing Committee on Health and Human Services. My name is Laura Harper, and I'm a senior associate at Moose Ridge Associates. I live in Hollowell. I'm testifying today on behalf of my client, the Campaign for Tobacco-Free Kids. For more than 20 years, the Campaign for Tobacco-Free Kids has fought to protect children and save lives from the #1 cause of preventable death, tobacco use. We are the largest organization in the nation focused entirely on reducing the impact of tobacco on our nation's health, especially through reducing youth initiation and use of all tobacco products. We are passionate and experienced public health advocates with a proven track record of leading and supporting successful policy advocacy campaigns. Simply put, this bill is a diversion tactic from big tobacco. Based on similar proposals seen in other states, this legislation is part of a national campaign by the tobacco industry to undermine meaningful progress in advancing evidence-based tobacco prevention and control policies by proposing changes that on their face sound meaningful, but in fact are unnecessary, ineffective, or have a negative impact on reducing tobacco use. None of the policies included in LD 1282 are evidence-based. There is no evidence that limiting the quantity of tobacco products one can buy in a single transaction will reduce tobacco consumption. In fact, the tobacco industry often uses promotions along these lines and may try to encourage customers to only buy 4 cartridges in a single transaction, which may result in customers buying more products than they intended. There is also no evidence that the age verification system proposed in the bill is effective in reducing tobacco use. Research shows that the most effective way of ensuring compliance to age of sale laws is by mandating compliance checks and increasing penalties on retailers, including mandatory license suspension and revocation for multiple violations. LD 1282 does not include any of these effective measures. And worse, LD 1282 is proposing these ineffective measures as a smokescreen to avoid more effective policies like mandated compliance checks, increased fines, and the elimination of the sale of flavored products that are so effective at hooking kids. Additionally, both Maine and federal law already require age verification, and federal law already require all online retailers of cigarettes, e-cigarettes, and other tobacco products to use an online database to verify the age of customers before sale. This bill essentially asks you to enact policies that are already in effect, all to avoid more effective laws. Lastly, federal law was recently changed to require all deliveries of these products to have face-to-face verification of ID and age for all purchasers. FedEx and UPS no longer will ship e-cigarettes or tobacco products, and the United States Postal Service is prohibited by federal law from doing so. Maine law was a leader in these efforts and banned online sale of tobacco products several years ago. No online retailers can sell tobacco products in Maine. So for all of these reasons, we do urge you to vote ought not to pass, and I'm happy to answer any questions if I can for you. Thank you.
Questions from the committee for Ms. Harper? I am seeing none. Rebecca Bullis, you're up.
Good afternoon, Senator Claxton, Representative Meyer, and distinguished members of the Joint Standing Committee on Health and Human Services. My name is Becca Bullis. I'm a resident of South Portland and Executive Director of Maine Public Health Association. And PHA is the state's oldest, largest, and most diverse association for public health professionals. We represent more than 500 individual members and 30 organizations across the state, and we are focused on supporting the communities of Maine to be as healthy as possible. I'm here today providing testimony in opposition to LD 1282. We do not support this bill for several reasons. Primarily, we oppose the bill because while on its face it appears to be helpful for reducing youth tobacco use, the provisions in this bill will have the exact opposite effect. As you've heard from both Laura and Hillary, the provisions in this bill are not evidence-based. There's no research to support the use of electronic age verification systems for improving compliance, or that limiting quantity of tobacco products purchased in one transaction will reduce use. And as you heard from Hillary, in fact, research shows just the opposite. The use of anchor marketing, which is what this bill would establish in statute, is effective at actually increasing purchase amounts. In my testimony, I've included a reference for you to Brian Wansing's work that looked at different types of anchor marketing and the effect on consumer behavior. And as you'll see with anchor marketing and scarcity marketing, which is what this does, it leads to increased purchases. Furthermore, there is research that does support that mandating compliance checks and increasing penalties on retailers are the most effective measures to reduce illegal tobacco sales to youth. And again, I've included citations for you if you're interested in looking at the research behind that. Unfortunately, this bill does not include those types of implementation measures. We are fortunate to know what works in tobacco prevention and control, and that is ending the sale of flavored tobacco products, increasing the price of tobacco products, and fully funding the state's tobacco prevention and control program. I want to thank the committee for its support of funding for the tobacco program. And I just want to echo again that we strongly oppose this bill, and we look forward to working with you, and I'm happy to answer any questions.
Thank you. Questions from the committee? I am seeing none. Thanks for being here today.
Thank you.
I believe that concludes testimony on LD 1282. Yep, seeing no other signed up, that would conclude testimony. Does the committee have any requests for additional information from our analyst for the work session? I am seeing none. So I will close the hearing on LD 1282, turn the gavel over to my co-chair, Senator Claxton, and he will continue along the afternoon in the following order: 196, 197, 360, 415, and 582.
Good afternoon, and I see we've been joined by Senator Breen to present the first of her two bills today. Welcome.
Thank you so much. I'm just going to make sure I've got the right testimony in front of me. All right, thank you, everybody. Senator Claxton, Representative Meyer, and distinguished members of the Joint Standing Committee on Health and Human Services. My name is Kathy Breen. I represent 6.5 communities in Cumberland County in the Maine Senate, and I'm here to introduce LD 196, a resolve to ensure access to community mental health services. This resolve directs the Department of Health and Human Services to increase reimbursement rates for Maine Care Sections 17 and 65, to provide daily living support services and home and community-based services for Mainers with behavioral health needs. Raising these rates will help service providers, agencies stay in business and allow them to pay their staffs a livable wage. As Senate Chair of Appropriations, I'm well aware that our economy is still recovering from the fallout of COVID-19. But where it concerns Mainers' behavioral health, I worry more about the cost of doing nothing. These costs are not always easily quantifiable. This bill will address the massive shortage of direct care workers. Vacancy currently number in the thousands. In order for providers to retain workers, they must compete with other employers such as Walmart, who can provide a steadily increasing minimum wage and a much easier workday. The low reimbursement rates also result in fewer psychologists and other behavioral health professionals who can continue to work with Maine Care recipients due to low reimbursement rates relative to private insurance and Medicare. Medicaid. Staffing shortages are also affected by raised rates elsewhere in Maine Care. Direct workers tend to go where the rates have been raised, leaving further staffing shortages in community mental health, which directly affects access to services for so many Mainers. And I just want to, I've been very public about this in the past, but for new members on this committee, I have a family member who is a recipient of these sorts of community-based services. And I can't begin to tell you how challenging the turnover is. And not only turnover, but if one of the staff people has a flat tire or has called out sick, the service just doesn't happen that day. My loved one is just left high and dry without support for that particular appointment or day or what have you. And I've seen it up close and personal, and it's very, very difficult for the individual and the rest of the family. The cycle of losing staff leads to our current pound-wise, penny-foolish situation. Lack of access to these services can lead people to seek out far more expensive treatments. I believe it's better to address these issues upstream than leave them unresolved and pay for treatment when the problems have intensified or when the patient has entered the emergency room or criminal justice system due to behavioral health issues. And again, to bring this to a personal level, I'm very fortunate that my loved one has not wound up in the criminal justice system, but I can tell you, we have spent weeks in emergency rooms in the past, in the not so distant past. We all know DHHS is currently conducting a Maine care reimbursement rate study, and we learned recently that rates for behavioral health services will not be studied until 2023. I applaud the study. I'm fully aware of the time and effort it takes to get an accurate picture of the complicated issue, but I believe we need to act in the short term to address these urgent needs. If Maine is serious about retaining its workers in this field and attracting more, we need to create a consistent and sustainable system in which our critical healthcare workforce are paid a livable wage. And I hope you'll support LD 196. And I know you have a lot of bills like this. I appreciate you hearing mine, and I'd be happy to answer any questions.
Thank you, Senator Breen. Are there any questions? I don't see any. So we have some folks who would like to testify in support of the bill, and we'll start with Betsy Sweet.
Good afternoon, Senator Claxton, Representative Meyer, and members of the committee, and Senator Breen. Thank you so much for putting this bill in. I know that this is not the first time I've been before you about these very specific rate increases for exactly the problems that Senator Breen has talked about. These services in this bill are the community-based services that keep people out of more expensive residential care, hospitals, and emergency rooms. You know, Maine has been in the past the envy of many states because of our breadth of community-based services. We have the structure, we have the bones of a system that could work. We have just under-resourced it. And in the past, the legislature has been asked to, as I've said many times, to make a Sophie's choice. Do we care more about people with developmental disabilities? Or do we care more about people with a mental health issue? Or do we care more about kids or children or community integration? Or, you know, and we pick and choose those services based on what seems most urgent at the time, not because it's what you want to do. I understand that. But what happens is it's like squeezing the balloon. Workers now have to, because we're so low paid, follow where the money is. And so if we say, okay, we're going to increase rates over here for developmental disabilities, very important, I totally support, but we don't do it over here for mental health, then the workers do exactly as they have done, which is they migrate to the service that pays more money. And which leaving even further staffing shortages and less access to services, starting always with the rural areas. So that is what we see. Last time we eked out a 2% increase while others got 10, 15, 20% raise. And so this just levels that playing field. Again, in the short term, as we wait for the long studies that are going to take, we can't wait for 2 years for something to happen, or this system that could be the envy of the nation is going to really fall apart. So I encourage you, I ask you to do these services. These are low intensity, community-based, home-based services that allow people to stay integrated and active in their communities. So I thank you for your attention. I'm happy to answer any questions.
Thank you for your testimony. Are there any questions from the committee? I don't see any. So now we can go to Jerry Marks. Welcome.
Good afternoon. Thank you, Senator Claxton, Representative Meyer, and other members of the Committee on Health and Human Services. I'm a resident of Portland and director of the Maine chapter of the National Association of Social Workers. We have 5,000 licensed social workers providing health care in the state of Maine. Social workers are the largest provider of mental health services in the nation. NASW Maine supports LD 196, a resolve to ensure access to community mental health services. As I understand it, the resolve directs the Department of Health and Human Services to amend its main care benefits manual to increase reimbursement rates for daily living support, as well as other community-based services by behavioral health professionals by 15%. A survey that we did of social workers throughout the state of Maine, 2019, identified low reimbursement rates and low pay as their top concerns. These conditions contribute to social work shortages, long waiting lists, and so forth, particularly in rural parts of the Maine, rural parts of the state. Specifically, lower reimbursement, as it has just been mentioned by two previous speakers, low reimbursement contributes to independent social work clinicians not accepting main care clients, which decreases access to much needed services for substance use disorders and mental illness in the Maine population. Some of these clients are some of the most needy residents of Maine, and yet they're not getting the services they could have access to if we had reasonable reimbursement rates. So this resolve helps to ensure access to community mental health services at a time when the nation has suffered through a long pandemic and continues to suffer with this pandemic. The aftermath may be felt for years in terms of mental health for vulnerable populations in Maine. So I urge you all to vote yes on LD 196. Thank you, and I'd be happy to take questions.
Any questions for Mr. Marks? I don't see any. So thank you for being here. Then we can go to Mallory Shaughnessy.
Good afternoon, Senator Claxton, Representative Myers, and members of the Joint Standing Committee on Health and Human Services. I am Mallory Shaughnessy, resident of Westbrook and Executive Director of the Alliance for Addiction and Mental Health Services, and I am here to speak in support of LD 196. As you've heard, this resolve amends the Section 17 and 65 to increase reimbursement rates for these daily living support services and community-based services provided by behavioral health professionals. Many agencies have had to curtail behavioral health professionals from being able to provide services to main care recipients in some rural areas because of this low reimbursement rate. When the only billable times are the direct contact hours with a client, disregarding drive time and paperwork involved, and the hourly rate does not provide coverage for this, it makes an untenable situation. Most agencies have had to virtually draw a red line of affordable drive time around their agency home base and leave those areas outside of the circle unserved because they just can't afford to. Increasing main care rates so that they're closer to covering the actual full costs of providing these services everywhere would allow the most at need Mainers to access these services and qualified professionals. Basically, all Mainers who need services should have access to them, and that's the bottom line. And I've got some data in here about the wait lists that are increasing for children's home and community services, medication management, many Section 17 and Section 65 services. The list could go on. The wait lists are increasing upwards of multiple months before people can get in. Some have stated that there are just not enough available and eligible Mainers to take these jobs, but that's not really the case. The reality is these jobs cannot compete with other businesses that have increased starting pay beyond the reach of the current reimbursement rates. So we do ask you to give this legislation a not to pass vote to make sure we keep these vital services. And I'd be happy to take any questions. Thank you for your time.
Are there any questions, Ms. Shaughnessy? I don't see any. I also don't see anybody here who wants to testify in support or against, or neither for nor against. So that'll conclude the public health of the the session on consideration of LD 196. And we'll see if there's any questions we'd like to direct to Aaron in anticipation of the work session. Everybody is in a post-lunch, post-morning fog. So there are no questions to go to Aaron. Okay. So as long as Senator Breen's here already, maybe she could present her second bill. What a coincidence. Except when you're still muted.
Thank
There
you
you go.
very much, Mr. Chair. So I'm still Kathy Breen. You are still the Health and Human Services Committee. Thank you very much for your patience and your listening skills today. This particular bill is a resolve, and it's a direct result of the public briefings that the Joint Standing Committee on Appropriations and Financial Affairs hosted last summer and fall in anticipation of a special legislative session, which never happened. As you will recall, we had adjourned early in March 2020 due to the pandemic. And then as soon as we were able, AFA then invited various types and sectors of businesses to describe how the pandemic was affecting them. We were the committee who was doing a hybrid in the room, on Zoom, masked, the whole thing. The Zoom thing actually is much better. But during those briefings, AFA got a direct request from mental health and substance use providers whose clients, services, staff, and budgets had been hit hard by COVID-19. Many of these providers were at the bottom of the list to receive PPE, meaning that they had to go out and find their own PPE to take care of their staff and their clients. Many of them also were not eligible to receive funds from the various programs that the federal government and the state government put together, either their nonprofit status or their size or various thresholds and criteria during those grant programs made those grants unavailable. And then also, I think the state suggested that they applied to FEMA for reimbursement for some of those costs. And FEMA is a very, very complicated application process that a lot of municipalities are used to doing, but nonprofit social service providers don't really have the staff and the capacity to do FEMA applications. So a lot of them wound up having to deal with the emergency with their own resources, which was very, very challenging. The resolve requires the Department of Health and Human Services to designate $15 million of Maine's share of federal COVID-19 stimulus funds for mental health and substance use disorder service providers. This will allow them to apply for revenues lost and extra expenses such as improved technology, reduced program census, hazard and retention pay, personal protective equipment, and more. This pandemic has deeply affected all of us, and we've all done a decent job coping as individuals and as a state. We know that one of the hidden epidemics is the toll it's taking on everyone's mental health. Our network of mental health providers have both taken economic and census hits in many ways, and they are in more demand than ever. More people who need service and increased acuity for many who are already receiving services. The relief and assistance from federal stimulus bills thus far for mental health providers has been minimal and sporadic. To make matters even more complicated, some have been able to access programs and others have not due to size, strict qualifications that left out mental health providers and other factors. In other cases, the amount that was available for assistance did not begin to meet the need. Designating money for mental health and substance use disorder services will help correct this oversight. Maine's portion of mental health block grant funding and substance use block grant funding from the American Rescue Plan is a combined $12 million, which will go a long way toward helping these populations. But given the underfunding of the programs for years, resulting in long waiting lists for service, I think we should reserve an additional amount of money to make a one-time investment in these services. I hope you'll agree and support LD 197, and I thank you, and I'd be happy to take any questions.
I have a question in the absence of any others. Is this money then will be tied to COVID-related expenses as the challenges came to the community mental health service providers?
Well, it would have to be consistent with what the federal guidelines are for the ARPA, the American Rescue Plan Act. So the COVID-related expenses you're referring to is money from the CARES Act. I'm not sure those sorts of parameters will be on this new money. We're still waiting for that, but certainly the providers would have to meet the federal guidelines.
Sure, that answers my other question. Thank you. I don't see any other questions. Thank you for being here, Senator Breen, and we'll move to other people who think this should pass, starting with Betsy Sweet.
Hello again. I am still Betsy Sweet, and I am still representing the Behavioral Health Community Collaborative. And I just want to say one thing that struck me while I've been talking to you is in years past, we have made sure that there have been actual providers here to talk with you. And this year that has become very difficult because they are stretched so thin trying to meet the needs of people, increased needs of people with mental health services while they try and keep their agencies together. So that's why you see me more and Mallory more than you have in the past. So I just wanted to make that little caveat, but believe me, they are here. And we strongly support this bill. We're so grateful to Senator Breen for bringing it forward because here's the problem. As she so eloquently said, the strictures around the money that came through in the first round meant that many organizations could not access it because either they were too big or they were too small, or there were so many very narrowly defined lanes in which they did not meet them. So at the same time, one thing that didn't get mentioned was the whole telehealth. So our agencies were buying iPads, installing internet for people so that they could access their services and their providers during this time. So there's this whole range of things that we don't think about, not to mention the increased wage in Portland, for example, is something that all of them have had to pay. And so again, which they have not been compensated for in any way, shape, or form. So this would create a fund that would be flexible in terms of organizations. Some organizations were able to access some money and some have been able to access some more since then. So this would be a fund that says, show us what you've lost in terms of actual dollars and also in terms of reduced census and in terms of retention pay for workers, and then apply. And very easily, this is meant to be a very easy fund with not a lot of RFPs and a lot of bureaucracy around it. As someone said to me the other day, we need to get this money into our services and to our communities as fast as we get the shots in the arm of the vaccine into people. And so this is the idea behind this. And I think, again, it provides for flexibility. I think the amount of money, we can sort of do a census pretty quickly of what the people we're going to apply for. So we would know whether it needs to be 15 million or 10 million or 12 million or what it needs to be given some of the other money that has come in. But I think the idea of having this money flexible, because small agencies need some things, bigger agencies need other things, and make it flexible, make it easy, make it fast, and help these organizations. Okay, and make these organizations not go under. Thank you very much. I'm happy to answer any questions.
Thank you. I don't see any questions, so we'll go to Ms. Shaughnessy.
Good afternoon, and I know you guys have had a long day. I am still Mallory Shaughnessy from Westbrook and Executive Director of the Alliance for Addiction and Mental Health Services, and very thankful to Senator Breen for bringing this forward. My testimony talks a little bit about the process we went through to seek some of these types of fundings over the last year. We had some of our agencies losing millions of dollars, others losing hundreds of thousands, and many of them did not end up whole for last fiscal year and are looking at deep holes for this year. One thing that I would share is, we do know very clearly that there's going to be a lot of money moving into the state of Maine, and we also know that one of the biggest impacts in many ways from COVID-19 is going to be these continuing aftershocks of mental health and substance use issues that are going to continue rising over the next several years. All the research shows us that. So one of the things I wanted to share with you is that some of our members also provide shelter services, and HUD actually put money in place immediately during this pandemic because these are critical services, and they were able to just simply send in invoices and send in statements of showing extra monies and things that were costing, hazard pay, the cost of cleaning, all these types of things that came up and that continue to this day. And they were made whole. They were able, HUD had set up a fund to do this, but Health and Human Services did not provide this kind of easy access to support for these essential services that are done for the state of Maine. And so this is just a really critical thing that you could do to assure this safety net stays intact. And I will leave it at that. You can see my written testimony. And thank you for your time.
Thank you very much for the testimony. I don't see any questions.
One last piece that I forgot to mention was just a lot of the agencies, what they're seeing is complete lowered cash flow than they've ever seen, which makes the, meeting payroll and staying open on a week-to-week basis, for some of them, very difficult. So just wanted to add that.
Okay. I don't see any other questions. All right. So in the absence of other testimony, I don't see anybody else who wants to testify related to for or neither for nor against. So that'll conclude the public hearing section on 197. And we'll direct any questions we might have to Aaron. Another easy one, Aaron. I don't see any questions. All right. Thank you again, Senator Breen, for bringing those two here, and we shall proceed. All right. So next we'll go to LD 360. And that would be Representative Madigan.
Thank you, Mr. Chair. Good afternoon, fellow colleagues on the Health and Human Services Committee. I'm Colleen Madigan. I represent House District 110, which is part of Waterville and part of Oakland. And I'm here today to introduce LD 360, which is a resolve to reduce barriers to recovery from addiction by expanding eligibility for targeted case management services. You have my testimony that I've submitted, so basically I'll explain this to you right now. Folks who have substance use disorder can only get targeted case management services if they meet certain criteria. If they're pregnant, they have minor children, or they've used IV drugs. We've heard just the other day, we heard from a ton of folks in the recovery community on how important it was to be able to access treatment services. We know we have an opioid crisis. We know we have a housing crisis. In this committee, we hear about a lot of those things. There's also a crisis in accessing substance use services. Many folks do not have these three conditions that would make them eligible for targeted case management services. This bill would allow someone who has substance use disorder to be able to get a case manager to help them navigate their way to be able to access treatment necessary. That may include medication-assisted treatment. It may include housing assistance, all the things that will allow someone to be able to get their life back, to be able to function better, to be able to work, to be able to pay taxes, to be able to be there for their family. And I think the most important thing about this bill is we all know that we need everyone in this state to pitch in and work and be there for their families. And this bill would allow folks to do that. We can't afford to leave anyone behind. We had a record number of overdoses last year. And this bill would allow folks to be able to access those services. It's really difficult to be able, without working in the field, to know how to get assistance for all these various things. I think this is the most humane thing we can do. And I think it's also important for our economic recovery. So many of the folks we heard in most recent days, when they talked about their recovery process, were able to describe how they went back to work and began to give back to their community. And that's what I see the heart of this bill is we want people to be able to get the help they need, get back on their feet. And they're our friends and neighbors, and they want to be there for all of us. So thank you very much, and I'll take any questions.
I don't think that prompted any questions yet. So let's hear from some of the people testifying in support. beginning with Danielle Blair.
Thank you. Senator Claxton, Representative Meyer, and other members of the Committee on Health and Human Services, good afternoon. My name is Danielle Blair, and I represent NASW Maine in support of LD 360, resolved to reduce barriers to recovery from addiction by expanding eligibility for targeted case management services. Currently, adults with substance use disorder must be pregnant, living with their own minor children, and/or using drugs intravenously in order to qualify for targeted case management services through Maine Care. Excluded groups include, but are not limited to, childless adults, including younger adults, aging adults, and some LGBTQ+ adults, non-custodial parents, and adults who do not use drugs intravenously. This severely delimits access to services that support safety and recovery at a time when Maine needs to do more. In 2020, Maine had 502 fatal overdoses, surpassing the previous high of 417 in 2017. This is a 20.38% increase. There were 58 fatal overdoses in January and 45 fatal overdoses in February of this year. These 2 months each saw more overdose deaths than the average of 42 per month in 2020, putting Maine on track to break the record number of fatal overdoses again in 2021. These data points mirror national trends that point to the COVID-19 pandemic as a factor in increased overdose deaths, although Maine's drug fatalities have been trending upward since 2014. Effective and accessible treatment services are more critical now than at any other juncture in Maine's history. This is why I encourage your strong consideration of this legislation, which would reduce barriers to recovery by expanding access to targeted case management services. Case managers improve retention outcomes in treatment, increasing length of recovery and reducing recidivism. Treatment is also more successful when comorbid disorders and other needs are addressed, making comprehensive services necessary to maintain recovery and to improve outcomes. Substance use disorder does not discriminate. Eligible individuals comprise only a fraction of adults challenged by substance use in Maine. My own brother started using substances when he was 12 years old and has not maintained recovery since. He is now 24. His son, a toddler now, is a stranger to him. While my brother would benefit tremendously from targeted case management, these services are inaccessible because he no longer resides with his minor child. How is he to recover if he has limited support in managing his substance use, his legal challenges, his work, and the complex process of reunification with a son in the foster care system? While I understand that this legislation will increase the direct costs of service provision for the state of Maine, ensuring that all adults with substance use disorder have access to targeted case management will decrease strain on acute intervention services like emergency rooms and jails, which are costly to individuals and to the public. Investing in these resources will reduce our total financial burden of care. To reiterate, targeted case management services are a critical wraparound support for adults with substance use disorder, and we have the opportunity now to reduce those barriers to recovery by expanding access to these services to a very large population of Mainers. I urge you all to vote yes on LD 360. I thank you for your time, and I am happy to answer any questions that you may have.
Thank you. Thank you for bringing the testimony. I don't see any questions. Appreciate your being here. Now we can go to Jennifer Christian.
Good afternoon, just for some variety. I'm Jennifer Christian of Dresden, Maine, and the project manager at the Alliance for Addiction and Mental Health Services. Please accept this testimony on the behalf of the Alliance in support of LD 360. The Alliance represents Maine's safety net-based mental health and substance use treatment agencies. We advocate for sound policies and evidence-based practices that serve to enhance the quality and effectiveness of our behavioral health care system. The Alliance and its members strongly believe that targeted case management should be available to all adults seeking substance use disorder treatment, and not just those that are pregnant or have HIV or as currently required under Maine Care Section 1303. Research proves that SUD treatment, substance use disorder treatment, and recovery success hinges on much more than the reduced use of abstinence from substances. The success of treatment and recovery models depends on connecting those seeking treatment to personal, social, and community recovery assets. Case managers ensure substance use disorder clients are more likely to receive individualized treatment and follow through on all their problems, not just the physical addiction component of their disease. Oops, sorry about that. Missing my page now. Well, I just wanted to say that I headed a project called the Pleiades Project in a recent demonstration project that proved that the case manager really does make a difference when it's offered to everyone. In a recent Alliance demonstration pilot program, the Pleiades Project offered SUD treatment regardless of severity of disease, with no eligibility requirements, to 4 provider sites around the state. With the addition of the case manager, the 4 demonstration agencies each saw improvement in their ability to provide comprehensive services at the appropriate level to clients. The Alliance Pleiades demonstration project treatment participants received full TCM services, targeted case management services, and showed improvement from baseline to follow-up in all the recovery asset areas measured: recovery engagement, recovery support, housing, food, stability, transportation, employment, income, medical care, mental health, family relations, education, and legal issues. One Pleiades program participant who suffered from
Seconds, please.
was able to receive comprehensive support while in her residential treatment program due to having a case manager through the Pleiades Project. She graduated and from the project successfully, and she's now able to complete her schooling and has been able to increase her self-worth and communication with family and peers. It's clear that targeted case management can and will improve treatment outcomes and future community integration success if offered to clients as needed. That's why we ask you to urge you to vote in favor of LD 360. We also submitted some of our research and our evaluation findings from the Pleiades Project, should that help you in during your work session. Thank you.
Thank you.
Is there any questions?
I'm not seeing any. So I understand that Mr. Devine has called in. And you're welcome to testify, sir, when you unmute. Mr. Devine, if you can hear us, we're ready to hear your testimony. There we go.
I unmuted myself. Can you hear me?
We can.
Okay, well, thank you. Good afternoon, Senator Claxton, Representative Meyer, and distinguished members of the Health and Human Services Committee. My name is Jim Devine. I live in Portland. I'm an advocate with Pearl Street Homeless Voice for Justice. If anybody doesn't know what Homeless Voice for Justice is, it's a advocacy group made up of people who all experience homelessness, you know, and most of my life I was a master electrician, a contractor, and I was able to house myself. But due to my struggle with alcoholism, I became homeless. I'm grateful I haven't had a drink since 2008, so I think I got that under control. But, you know, over the years, I had a struggle with my alcoholism, and I got a lot of help from various services like Milestone and Serenity House and Mary Meeting House in Bordenham. Serenity House and Mary Meeting House have both closed down. So, you know, I'm grateful for the services I received, but I certainly think that making services more available to people would be beneficial. I mean, I've never used intravenous drugs, and I'm not pregnant, but my struggle with alcoholism was just as deadly as intravenous drugs, in my opinion. So, you know, expanding the services to make everybody struggling with addiction available to receive services definitely has my firm support. And I'm speaking for Homeless Voice for Justice, which definitely endorses this bill. So I think that's all I have to say. Thank you very much.
Well, thank you for taking the time to call in. We appreciate that. All right. I don't see any questions for Mr. Devine. And I don't see anyone else who'd like to testify related to LD 360. So are there questions we'd like to direct to Aaron? I don't see any coming in. Okay, so that'll let us move on to LD 415. And I see that Representative Stearns is with us. We're ready for your bill, sir.
Oh, very good. Senator Claxton, Representative Meyer, and distinguished members of the Joint Committee on Health and Human Services. I'm Paul Stearns, and I represent House District 119 in Piscataquis County, and I'm seeking your support today on behalf of some of Maine's most vulnerable citizens, those with intellectual and developmental disabilities. When I was asked by a constituent, Mr. Schaefer, by the way, who is also giving testimony today, a constituent that works directly with this population, if I would bring it forward, I gladly agreed to. I immediately reached out to Representative Myers to see if it was her intent to resubmit her bill, LD 1940, from the 129th legislature. As veteran committee members will note, the language of this resolve is the same as that bill. We had a good conversation about the feasibility of getting this passed during such difficult budgetary times. I decided to submit it anyway, as there will never be a time when it's easy to find money. And the need is pressing, and it's not going away. If not now, when? I'm delighted that Representative Myers is co-sponsoring this legislation, as her understanding of the dynamics involved far exceeds my superficial knowledge. In the interest of time, I would ask committee members to review her testimony from January 30th of 2020, which I provided to the clerk. I could not have begun to frame the issue any better. I'll do my best to answer any questions that you may have, but assure you that committee members and speakers to follow have far more experience than I do. Thank you for considering the legislation.
Thank you for bringing this bill forward, Representative Stearns. Yes, Representative Meyer.
Thank you, Mr. Chair. I want to thank Representative Stearns for bringing this bill forward.
I thought you were going to ask him a tough question.
You're more than welcome,
No tough questions, just my thanks.
And when this passes, Representative, and I'm up on the podium receiving a wonderful award for this, I'm going to push you out of the way.
All right, now
Noted.
let's be nice. Let's be nice here, people. All right. Thank you for that, Representative Stearns. As long as you've referenced Charles Schaefer, why don't we ask him to unmute and offer his testimony.
Yep, I'm trying to there we go.
There we go.
There we go. Took a second here. Senator Claxton, Representative Meyer, and members of the Health and Human Services Committee. My name is Charles Schaefer, and I'm here in support of LD 415. I'm a community case manager with ISC for Me, LLC. We are in Bangor. We're a waiver section 13 targeted case management agency. We serve approximately 200 clients in 50 towns, 6 counties, and that's just in central Maine. I'm the former DHHS ODES advocate in the Bangor region, have approximately 40 years of experience serving individuals and families with mental health, substance abuse, intellectual disabilities, developmental delays, and autism. And I'm also the parent of 2 young adults with autism. In addition to my direct client experiences, I have a background in social service policy, compliance, investigations, contract management, and staff training. Adults with intellectual and developmental disabilities and adults with autism are required to have case management in order to receive services under the HCBS waivers, Section 21 and 29. Targeted case management refers to case management for a specific Medicaid beneficiary or a specific group, or for individuals who reside in state designated geographic areas. So when used by Medicaid, targeted case management has to do with providing case management services to specific target populations. But whether the phrase refers to targeting individuals or populations is less important than the fact that targeted case management is part of the individualized revolution in human services that is going on in society today. And in fact, today's case managers are truly the bridge over troubled waters. It's a very, very complicated system, as most of you know. Social service providers at all levels recognize that a one-size-fits-all case management solution is outdated. Instead, by using targeted case management, case managers are starting to think in terms of solutions that are specific to the needs of the individual or to the group that they are serving. In Maine, the ending of direct case management services provided by the HHS in 2017 moved over 1,200 adults with intellectual disabilities and autism into community providers. This amplified the need for targeted case management services. Since 2017, TCM providers have also become the default go-to for anything that DHHS or ODES does not want to do, including tasks that are mandated by Medicaid rule, but which the department passes off to others. And often these tasks are now being done by case managers, and it's not billable time, essentially requiring that private agencies subsidize DHHS. There remain significant wait lists for both children's and adult services. Case management is necessary to meet the needs of these individuals and for the 250 plus families on the Section 29 wait list. TCM is their only connection to support services. The rate paid to providers for these essential services has not changed in a decade, even though the CPI healthcare cost index has increased by 30% and the overall CPI has increased by 20%. There's been no adjustment to the reimbursement rate paid to providers to compensate for the inflationary pressures of wages, healthcare insurance, workers' comp, and other regulatory mandates. In the current atmosphere of low unemployment and increasing wage pressure by businesses desperate for workers, it is difficult for agencies to recruit competent and knowledgeable staff and keep them. Given the complexities of the job, it can take over a year to train a new employee. Recruiting and retention is very difficult for many service providers, and you can ask DHHS, which actually pays 25% more than the average private agency, plus has a full benefit package, which many agencies have no benefits. So this lack of resources costs the agencies good employees that they need in order to continue to provide these critical services. I'll be available if you have any questions, either after this session or for the any subsequent work session. And I've attached written testimony that has a more detailed job description for what a typical case manager is responsible for. I encourage you to support LD 415 and thank you for this opportunity to address the committee.
Thank you, Mr. Schaefer. It looks like there's a question from Representative Madigan. You're still on mute, Representative.
Thank you. Thank you, Mr. Chair. I have two questions for you, Mr. Schaefer, and I thank you for being here and for offering your testimony. The first is that this bill is regarding targeted case management services for the IDDD community, correct?
Correct.
So I have noticed the same pressures operating on targeted case management in other populations or for other sections of Maine Care. And one of the things I've noticed is basically kind of what you said, that those pressures cause employers not to offer benefits anymore, reduce benefits and stuff like that. I wonder kind of if you're aware of that and what your thoughts are about that, about just targeted case management services in general across different sections and populations.
At one point in time, somebody with a case manager under Medicaid rule is required to have a bachelor's degree at minimum. And it can take at least a year. I think when I worked for DHHS for a number of years, I think they anticipate 18 to 24 months to bring a case manager up to speed. When you're paying slightly more than minimum wage right now, which is what the average is, there's no way you can compete. If you can go to McDonald's for $15 an hour and the worst thing that happens is you drop a hamburger and somebody yells at you, versus making a mistake or somebody gets denied services or ends up ill, or there's a lot more responsibility, and there's no compensation for it. And most agencies could not keep up with the cost of healthcare, especially, that it would bankrupt them. So the federal government came up with the idea that targeted case management was a good thing because it would be very specific, and they would essentially be a liaison between the Medicaid and the actual providers, and kind of an oversight. So that it's really a vital function, but the reimbursement system hasn't kept up with it. Now, I've noticed in some recent federal legislation that they want to expand those services to include more in substance abuse and mental health. It's not a field that you can cross over. You need training in intellectual disabilities or substance abuse or mental health. It's not one size fits all. So I think it would be a lot cheaper in the long run to invest the time and money into setting up a good system versus trying to piecemeal everything together, which is really what we've been doing for years. It looks like a crazy quilt.
Thank you. Are there any other questions for Mr. Schaefer? I don't see any. So now we can go to Christine Walker.
Thank you. And much of my written testimony also agrees with Mr. Schaefer, so I'll try to leave those pieces out and just focus on the others that you haven't heard. Good afternoon, Senator Claxton, Representative Meyer, and members of the Health and Human Services Committee. My name is Christine Walker, and I'm a program manager for the Children's Case Management Program at Independence Association in Brunswick. I've been there for 25 years this year, and I appreciate the opportunity to come before the committee in support of the LD 415. Case managers are definitely the first point of contact for many families. Very often we're the only service in the home. The service system is very large and it's constantly changing, and it is our jobs to keep up with those changes so that our clients and families can get the most current information and not be overwhelmed. Case managers offer information about what services and supports are available. We provide resource coordination, referral and linkage. We monitor services that are already existing. We provide advocacy support, parental supports. In our agency, there are 5 full-time case managers for kids and myself. We definitely believe this is a professional position. It requires at least a bachelor's degree and 1 year's field experience for minimum to hire. However, case managers need much more in their arsenal, as Mr. Schaefer said, to support youth and families nowadays. We're facing more and more complex cases, while at the same time needing to be creative with dwindling resources, increasing unfunded mandates, minimal or fragmented natural supports, and lengthy wait lists for most services. In my career, I've seen years without raises and the continued reduction of benefits. I've witnessed case managers leaving for higher paying jobs with better benefits everywhere. Despite the fact that my peers and I have advanced education and the experience that has literally changed the lives of kids in meaningful ways, the fact is we barely earn more than any individual in a fast food restaurant. Last year, I shared with you that I had I shared part of my day with you. One of those instances was that I was meeting with a parent to work on her son's main care applications. He was recently found ineligible for the coverage. It's kind of a glitch that happens sometimes. Her son has severe intellectual disabilities, exhibits behavioral and safety challenges at home and in the community. He's impulsive.
30 seconds, please.
Wanders away from caregivers and has poor judgment. The son has since attained main care coverage due to our efforts together, and he's now eligible for in-home supports to address skills building and behaviors and safety skills. However, there's still a lengthy wait list for that service. The mom continues to work 60 hours plus a week, and now she's an hour away from home for her employer, and it's still she's still the primary caregiver in the home. She is also being evicted due to the landlord selling their home, and with the housing crisis, they have 1 month to leave their home of 8 years. The son is 18 now. He's still accessing special education services. Amidst all of the day-to-day tasks that this parent needs to worry about, she is also working with us, case managers, to explore and pursue guardianship of her son, apply for his adult Social Security benefits, explore work opportunities for him, manage his safety, and more. And I just wanted to end by saying, you know, this service is truly vital for so many families. We do much more than the standard sort of care management. We are a global service, and we, you know, work within the system that we have. We would certainly appreciate you favoring this LD 415. Thank you. Any questions? I'm here too.
Are there any questions? Christine, I don't see any. Thank you. Let's see here. I'm going to turn it over to Representative Meyer, so I need to make a scheduled phone call, and I'll be back.
Thank you, Mr. Chair. We would welcome Laura Cordes.
Good afternoon.
Good afternoon.
Departing Senator Claxton, Representative Meyer, and members of the Health and Human Services Committee. My name is Laura Cordes. I'm the Executive Director of the Maine Association for Community Service Providers, MAXPE. We're a statewide association of more than 70 organizations providing services and support for thousands of children, adolescents, and adults with intellectual and developmental disabilities throughout our state so that they can live full lives throughout the community of their choice. Thank you for the opportunity to testify in support of LD 415. I appreciate Representative Stearns introducing the bill today. Section 13 of MaineCare is targeted case management. It's available for 6 different populations: children with behavioral health disorders, developmental disabilities, chronic medical conditions, as well as adults with developmental disabilities, substance abuse disorders, HIV, in addition to members experiencing homelessness. As I read and understand LD 415, it does apply in increasing rates to all sections, or all services rather, and for populations under Section 13. You've heard and we'll hear from experts in the field today about how essential case managers are for children and adults with IDD and autism, and just how underfunded these services have become over the last decade. During that time, that's when the state began to transfer nearly all its case management services to community providers. It's meant a myriad of unreimbursed duties that have fallen to them. There's also an extensive list of annual and non-billable trainings for case managers of both children and adults with intellectual disabilities, and the burden on case management agencies is significant. I encourage you to review the testimony submitted by Bridget McCabe, who has listed a full list of billable and non-billable services that case managers perform, along with the long list of training requirements. As you've heard in previous hearings, MaineCare Section 21 and 29 have a combined wait list of nearly 2,000 people with IDD in Maine, and there are over 1,000 additional children waiting for Section 28 and Section 65 services. And that means that hundreds of children and adults on these wait lists, case management is the only service they're currently receiving. Low reimbursement rates most community case management agencies, because of that, are really only offering $16 to $18 per hour. The state of Maine, however, as you heard previously, last year was offering positions, posting them to hire between $23 and $30 an hour. That pay disparity is not only fundamentally unfair, it creates unhealthy competition for case managers and drives up the turnover and unfilled positions that we currently have. Case managers for children and adults are really on those front lines, and we encourage you to support this bill and to implement a rate that is just fair and equitable and reflective of the current cost. Thank you for your time and consideration.
Thank you, Laura. Questions from Ms. Cordes? Seeing none, we would welcome Nicole Corte.
Hi there, and good afternoon, Representative Meyer and members of the Health and Human Services Committee. I agree with everything that's been said before me, but I would like to add to it. When I started working as a community case manager for Living Innovations less than a year ago, I didn't expect to become passionate enough about my position to speak to the legislature in support of LD 415. My name is Nicole Cordy, and while I'm far from an expert in my field, it has only taken 6 months to learn case management meets a need no other service comes close to meeting. As you know, case managers are vital to coordinating critical services such as housing, employment, and medical care for individuals with intellectual and developmental disabilities. I want to tell you about an older gentleman who I meet with on Zoom 3 times per week. Before the pandemic, you could find him giving monthly historical lessons at his library or serving as his church's historian. Now he is more likely to be studying the pandemic. If it is the right time in the afternoon, he's riding his bike by the ocean. It may surprise you that this bright historian and cherished community member has struggled to find meaningful employment or attend a routine doctor's appointment. That's where case management comes in. By speaking with him so often, I built a relationship grounded in something he states his life has always lacked: mutual respect. He began to share personal details with me, like his memory of his mother taking him to the local doctor as her favorite form of punishment. A few months after meeting him, I asked if he would meet with a therapist. To my surprise, he said yes. It was not long after that that he thanked me for finding him a trusted confidant. I took a leap of faith and asked him to attend a doctor's appointment via Zoom, his first appointment in years. He stated that because case management and therapy appointments went well, he was willing to venture into the world of medical care. He now has an annual physical scheduled for next month. Without case management, he never would have been connected to a therapist or doctor. While you and I might be hesitant about checking up with a doctor, we do not know what it means to be outside of the very system built to help us. With the help of case management, he is learning to trust the people and systems put in place to meet his needs. While this is a success story, it's also a story about case management. The work does not stop here. This year, I will help him, a man with years of historical experience, find meaningful employment through meetings with job development, vocational rehabilitation, and benefits counseling. I will help him complete a home inspection to ensure that his housing subsidy continues. I will recertify his main care coverage and food stamp benefits. I will continue to help him budget and save money while paying for things he loves, like books and the TV channel that gets Gunsmoke. This all falls under my role as case manager, and I
30
love
seconds,
it.
please.
He is just one of 23 people I currently support. Everyone has their own story, their own barriers, and their own goals. I value my career, and in return, the individuals I support value the services available to them. Please consider supporting LD 415 to reflect the value case managers bring to the state of Maine. Thank you for your time today.
Thank you, Nicole. Questions for Ms. Corte? Seeing none, welcome Andrew Taranka.
Thank you. Good afternoon, Senator Claxton, Representative Meyer, and members of the HHS committee. My name is Andy Taranko, and I'm the State Director for Living Innovations, a service of Mosaic. Living Innovations is a multi-state nonprofit agency serving children and adults with intellectual and developmental disabilities and autism. I'm a board member and chair of the Targeted Case Management Committee for the Maine Association for Community Services Providers, MAXB. I've submitted my written testimony in support of LD 415, and I'm really here as a resource to answer questions and to support the families and colleagues that will be presenting in support of LD 415. I testified last year on 1940, the same bill. And just a little bit of background, I've worked in the developmental disability and autism field for 23 years. I've been a child case manager and an adult case manager, and I've supervised both of those programs. And I started the case management program at Living Innovations. And in those years, I've just seen us go from a state-based system to a solely community-based system. And would like to see the rates continue to progress with the cost of inflation. So as I said before, I'm really here to answer questions. And I just would acknowledge that last year, when you all heard this bill, there were 38 pieces of testimony, and those are great things to read. And there's already 20 pieces posted today. So I don't want to take up any more of your time, but I would just acknowledge that reading parent and guardian testimony, both from last year and this year, would be valuable in understanding the necessity of this service. And with that, I'll see if there are any questions, and I'm happy to be available for a work session as well.
Thank you. Questions from the committee? Seeing none, Andy, thanks for being here today. Mr. Vincent Renteria, welcome.
Hello, yes, good afternoon, Representative Meyer and members of the Health and Human Service Committee. My name is Vincent Renteria, and I'm a senior community case manager for OHI. I appreciate the opportunity to come before the committee in support of LD 415. OHI has provided over 40 years of supporting and serving adults with intellectual and developmental disabilities in Maine. At OHI, we meet people where they are, and we support them to where they would like to be. I have been with OHI for 8 years in the Bangor area. I became a case manager in 2016, and I'm currently serving 33 individuals on my caseload. I also provide support in our residential group homes as a direct support professional on weekends. Working as both a case manager and a DSP has allowed me to see firsthand how a plan of care is created, received, and implemented. Case managers coordinate with all members of the team, from guardians, members, home, community, work, medical, state, housing, and many other providers to facilitate the highest level of services and supports possible for each individual. Case managers are the bridges that connect children and adults to the critical services they would otherwise be without. Oftentimes, case managers are the only contact a member may have with the community. We use this connection to monitor services, a person's health and safety, while also encouraging and fostering growth and personal development. A personal story of mine I'd like to share. I have a member I support who had been struggling with staying home in her apartment and distancing from others after COVID hit Maine last March. Her desire to leave grew after she began to believe that bugs were biting her in her apartment. An exterminator evaluated her apartment a couple of times and could not find any bugs, but the belief was so strong, she began leaving her apartment to spend the night outside. Her behavior was reported by her home supports to the doctors in the ER after she was brought in for evaluation by the police. After she was released, she fired her home supports and desperately wanted to move. Thankfully, her name came up on a subsidized housing wait list she had been on for 2 years. And after working to submit all the paperwork for the apartment, she was able to move. However, with no supports and having to use a walker, there was no way she was going to be able to move everything on her own. As her case manager, I'm obligated to support this member. So I went to work to hire a moving company, assisted with the move, and monitored and supervised the moving. Following the move, I also supported the member to clean her old apartment to secure her deposit. She is now settled into her new place, working with a new home support agency, and is getting ready to begin a community support program of her choosing. She feels safe, seeing her doctors, making friends, and has a growing relationship with another tenant. Without case management services, this story could have had a very different and tragic ending. Targeted case management plays a vital role in not only connecting families of children and adults with intellectual and developmental
30 seconds,
disabilities.
please.
Thank you. And mental health afflictions to necessary services, but also maintaining and monitoring those services so that no individual is left behind and members are satisfied with the services that are being provided. Financial compensation is not always the reason a person chooses to be a case manager, but is often the reason why a person chooses to leave the position. Despite the rising cost of living, working, traveling, and operating such monumental services such as targeted case management, targeted case managers have not seen a reimbursement adjustment since 2009, as you all know. The situation has become dire for many agencies tasked with serving individuals with special needs. Without greater incentive to build that workforce, tragedies will happen. Case managers are carrying greater caseloads, impacting the quality of services, further eroding the confidence in the system. The maximum number a case manager can have is 35. OHI has not been immune to staff burnout, high turnover rates, frustrated families, and ever-growing non-billable responsibilities and rising costs of travel, training, and operation. Without an adjustment, soon many members will have to wait for support or worse, go without. Please help us support Maine's most vulnerable. I implore you to support LD 415. Thank you for your time and consideration of this testimony. Please contact me with any questions. I'm an open book.
Thank you, Mr. Renteria, for that story, that success story, and for the work that you're doing. Questions from the committee? He's an open book. Ask him a question. Thanks again for being here.
Thank you.
Maureen Bilodeau.
Good afternoon, Senator Claxton, Representative Meyer, and members of the Health and Human Services Committee. My name is Maureen Bilodeau, and I am the Director of Children's Services and Case Management at the Progress Center. I appreciate the opportunity to come before the committee in support of LD 415. The Progress Center has provided services to children, families, and adults who are living with disabilities and mental health disorders in Maine for over 40 years. We serve over 400 individuals and employ about 160 community members. We currently work with individuals in 8 counties. Here at the Progress Center, we provide critical case management services to adults with disabilities as well as children with disabilities and/or mental health disorders. Case managers are incredibly important in connecting folks and their families with services that support their basic needs. Community case management develops and oversees a comprehensive and individualized person-centered plan with an emphasis on principles of empowerment, community inclusion, health and safety, and the use of natural supports. Our team provides support, advocacy, and coordination of services that our clients receive through waiver services, children's case management Children's case management assess those who are in need and develop a comprehensive plan on how to guide families to a level of independence, often introducing parents to services that are available in the community that they would otherwise not know about and cannot access themselves. We struggle to hire, train, and retain good case management and are hardly ever able to meet the pay demands of those with experience. Often we are training folks just out of school, increasing our training time with them, and then seeing them move on after a year. This is devastating to the industry. The population we work with has a difficult time with transition, and when they have developed trust with their case manager just in time for them to have a change in case manager, they lose faith in the system. In adult case management, there are changes occurring regarding HCBS, which is impacting case managers by increasing job duties. Case managers are experiencing increased caseloads due to offset costs of increased expenses and current reimbursement rates. In children's case management, we are experiencing difficulty in providing competitive wages and benefits without increasing already large caseloads.
30 seconds, please.
During the past month, we have had 2 children's case managers and 1 community case manager resign from their positions due to increased stress and anxiety symptoms negatively impacting their work, health, and well-being. Those individuals made the difficult decision to leave their position in which they enjoyed and developed close working relationships with their peers. I have received an increase of parent and client concerns related to turnover in their case manager. Another concern that is impending is legislature that is looking to increase minimum wage without increasing reimbursement rates. How will agencies support such increase in costs? I urge your support of LD 14. Thank you for your time and consideration of this testimony. Please contact me with any questions you may have.
Thank you. Questions from the committee? Seeing none, we're glad you could make it here today.
Thank you.
Brenda Smith.
Good afternoon, Senator Claxton, Representative Meyer, and the Health and Human Services Committee members. I am testifying in support of LD 415. I have submitted written testimony, so I'm just going to give you a brief synopsis, and because it really does mirror a lot of what others have had to say. So my name is Brenda Smith. I'm a licensed clinical social worker with Wadman Projects in Sanford, Maine, where I oversee the adult case management program. I have almost 20 years experience providing case management services to adults and children. And during this time, I've seen the system increase in complexity, along with the stressors facing recipients of case management services. And due to the lack of rate increases over the past 12 years, case managers are expected to pay 2021 prices for housing, transportation, daycare, and other costs with 2009 pay. Many have had to leave the field for more lucrative employment, and those who are left often leave to burnout due to high caseload numbers. Caseloads are not only high due to lack of staffing, but also because agencies are forced to increase billing requirements in order to cover rising costs. This is a disservice to those case management is meant to support. As you've heard in other testimony, case management is an essential service and often the only lifeline that vulnerable Mainers have. And as you've also heard, oftentimes it's the only way for them to get into other necessary supported services and community-based services. And I really do fear without a raise in the rate, the entire system could eventually fall apart, and it's going to cost us more. The other thing I'd like to add is that I'm also a sister of an individual with an intellectual disability who resides in a 21 funded waiver home. And I know firsthand, even though I'm in the field, my parents who are her guardians, how much case management mean to them, and having an effective case manager. It's so important, the trust that they have to build to make sure that she's receiving what she needs. She's not verbal, and she relies fully on her providers. And especially during COVID, a lot of times, they weren't able to see her and visit her. So having that trust and support and not having constant turnover is so important, and the expertise that the case managers bring to the table. So I do hope that you will consider moving this forward. Thank you for your time and consideration, and I'm happy to take questions.
Questions from the committee? Seeing none, thanks for being here today.
Thank you.
Mr. Patrick, welcome.
Thank you. Good afternoon, Senator Claxton, Representative Meyer, members of the committee. I'm Douglas Patrick, Director of Case Management, Behavioral Health Services at Woodford Family Services, nonprofit 501c3 in the Westbrook area. I'm testifying in support of LD 415. I agree with all the testimony that's been presented so far. Woodford's provides case management services to approximately 400 individuals with developmental disabilities. We have 17 full-time case managers in Cumberland and York counties. You've heard that testimony about the lack of an increase in a rate for about 10 years now. And just to reflect what that means in real terms, and included in my testimony, if you look at the cost of transportation, the federal mileage rate was increased 14% from the period of 2010 to 2019. The annual average employer contributions rose for healthcare 22% from 2009 to 2019, according to the Kaiser Foundation. According to the Bureau of Labor Statistics, and if you look at the salaries that are paid for case managers, you will note that case managers actually are earning less than administrative assistants, $36,000 compared to $35,000 for entry level on average. I wanted to just speak to another piece, which to appreciate the extent and scope of the work that case managers do. This is not an entry level job. This is probably one of the most difficult jobs in human services. I've been involved in many different services and human services over the years, but these case managers are responsible for the whole life of a person. Their safety, security, health and well-being, their housing. So they need to be experts in the following areas: Social Security, general assistance, SNAP, transportation, housing, education, employment, physical health care, mental health care, substance abuse, developmental disabilities, criminal justice, obtaining accommodations for public spaces, speech and language services, occupational therapies, physical therapy, crisis planning and management, adult protective services relationships, behavioral management plans,
30 seconds, please.
and supported decision-making and guardianship proceedings. They are responsible for covering all of these aspects of an individual's life, and to know in detail what those areas include. So I would offer to the committee to answer any questions. Again, I am speaking in support of LD 415 to increase the targeted case management rates to reflect the cost of inflation. Thank you.
Thank you. Questions from the committee? Seeing none, thank you for being here today, Mr. Patrick.
Thank you.
Jennifer Christian, welcome. You are mute. Oh, there you go.
Good afternoon again, Senator Claxton, Representative Meyer, and esteemed members of the Joint Standing Committee on Health and Human Services. I'm Jennifer Christian of Dresden, Maine, and I'm speaking on behalf of the Alliance for Addiction and Mental Health Services in support of LD 415. LD 415 would require the Department of Human Services to increase the reimbursement rate for Section 13 for targeted case management to reflect inflation over the past for services that haven't changed over the past 12 years, as you've heard, basically since 2009. The thing I'd like to emphasize is that about this that several people have touched on is it's important to people with developmental disabilities, but this is also really important to people with substance use disorder, and that would include youth and adults and adults with HIV, as well as people experiencing homelessness. And so I just want that to be really clear that this bill also includes those populations as well. Unfortunately, this reimbursement rate, as we know, hasn't been increased since 2009. And the capacity for providing this service has been diminishing over time as wage increases, employee health insurance, as well as a myriad of other costs have increased. The COVID-19 crisis has also made things worse for providers and it's caused a decrease in qualified workforce availability. Not to mention there's no reimbursement for travel time, recent increases in paperwork, or other workload items not deemed as direct service. So with the growing wait lists for all these groups, including the youth, the adults, and those experiencing homelessness and those with substance use disorder, as well as those with IDD, these groups, the wait lists are just getting so long and the workforce is getting smaller and less available. And this is a thread that runs through all of these eligibilities. And so I'm urging you to vote ought to pass on LD 415. Thank you. I'm happy to answer any questions. Again, having worked as the project manager on the Pleiades project, which I talked about on LD 360, we have found out just how important targeted case management is across the board for all people that are experiencing SUD or IDD. So I just urge you to recognize that it's a large population that these very skilled workers cover. Thank you.
Thank you. Questions from the committee? Seeing no hands up, we appreciate your being here today.
Thank you.
And finally, Jerry Marks, welcome.
Thank you. Dear Senator Claxton, Representative Meyer, and other members of the Committee on Health and Human Services. You can see I submitted written testimony earlier this week. I introduced myself earlier at this hearing today. I'm the director of the Maine chapter of the National Association of Social Workers. We have 5,000 licensed social workers in the state of Maine, where the social workers are the largest provider of mental health services in the nation. NASW Maine supports LD 415. This resolve requires the Department of Health and Human Services to amend its rules governing Maine care reimbursement for targeted case management services to basically provide for a cost of living increase. My understanding is that there hasn't been such an increase since 2009, so it's long overdue. I mentioned in my earlier testimony today that in 2019, we did a survey of social workers throughout the state, and low reimbursement rates and low pay were the top concerns of our members. Specifically, low reimbursement ends up with independent social work clinicians not taking Maine care clients, not because they don't want to, but they can't afford to. And what happens is we have a decrease in services for Maine residents, and in this case with disabilities. And our Maine care clients are some of the most vulnerable people in the state. So we really, we feel this resolve will help ensure access to disability services for both children and adults in Maine, and I urge you all to vote yes. And I'd be happy to answer any questions.
Seeing no hands going up, we thank you for being here today. That concludes testimony on LD 415. Does the committee have any requests for additional information from Aaron? I am seeing none. So I will close the hearing on 415 and open the hearing on LD 582, an act to support the fidelity and sustainability of assertive community treatment, presented to us by Representative Colleen Madigan. Welcome.
Thank you, Madam Chair. Good afternoon, Senator Claxton, Representative Meyer, and fellow members of the Health and Human Services Committee. I am Representative Colleen Madigan, and I represent part of Oakland and part of Waterville. I'm here today to introduce LD 582, an act to support the fidelity and sustainability of assertive community treatment. For those of you that know me, you know that I'm a big believer in evidence-based treatments in behavioral health. We should do our best in committee and in our state to encourage, support, and pay for treatments that have been shown to work. Assertive community treatment is one such evidence-based model of treatment for people who have serious mental illness. This model has been around since the 1970s and has been extensively studied. It first started in Madison, Wisconsin, in response to deinstitutionalization. For many years, it was known as the Madison model. I first learned of this model in the 1980s. I know that seems long ago and that perhaps dinosaurs roamed the earth, but I'm here to tell you that decades of research has proven that this model works. ACT is recognized as one of the most influential service delivery systems ever devised in community mental health. It is one of the most studied interventions in the mental health field. My very first day working in the mental health field in the 1980s, I job shadowed the outreach worker for the agency I worked for. He had come from Madison, Wisconsin, and was trying to bring that model to our employer. Years later, in the early 2000s, I worked on the ACT team that covers Kennebec County. I also did my graduate school research project on adding substance use disorder groups to an ACT team model. ACT is a model that uses a multidisciplinary approach to community mental health. A psychiatrist, psychiatric nurse, social workers, employment specialists, etc., are part of a team. This approach recognizes that having a serious mental illness impacts all areas of a person's life. Services are designed to be available 24/7 and be based in the community where a person lives. This bill adjusts the definition of ACT services to better align with the evidence-based model of treatment. It adds in a medical assistant as part of the ACT team model, as this is part of how we provide care in the 21st century. This bill also puts the importance of maintaining fidelity to the model front and center. I cannot stress the importance of this in behavioral health care enough. The research supports adhering to this model. It is not that different from your medical provider following the research on what dosage of medication you should receive or for how long. This bill also asks for a 25% rate increase to support this model, as it is a team-based approach. Thank you very much for your consideration. I look forward to working with you on it. And I just want to mention that this is a model that has become, that so many new things that even we see in mental health these days draws from. The peer program, which we've heard a lot about in Portland, actually comes out of this kind of multidisciplinary way of looking at things, looking at that, particularly for young people when they start developing mental illness, that getting them assistance to kind of rehabilitate or rehabilitate all areas of their life is how people move into recovery from a serious mental illness. And when you think, and I want to make sure that people understand what evidence-based practice is in mental health care, we don't really think too much about research, but we should, because the same kind of standards that apply in medical research also apply in behavioral health. This method has been studied, using double-blind studies. It actually has been studied every time, they've had a new idea as far as why perhaps adding an employment specialist is important, or why having someone who has certification treating substance use disorder. All that is important. And the rate needs to support that. And maintaining the fidelity means that we're paying for someone to get the complete complement of what this model offers. In other words, we can't just say it's, an ACT team model if we don't actually support maintaining the fidelity to what that model is and paying for that. And it's been proven time and time again over decades that this actually helps people reach recovery. and become better functioning members of their community. And, the model is meant to, titrate down as people do better. And that's really what it's offered over many decades, the field of mental health, and for consumers who have benefited from it. So I'm happy to take any questions.
Thank you, Representative Madigan. We appreciate your experience and expertise and skill in explaining these things to the committee. Questions for Representative Madigan? Seeing none, we will move to Holly Canva. Holly.
Hello. So good afternoon, Senator Claxton, Representative Mayer, and esteemed members of the Joint Standing Committee on Health and Human Services. My name is Holly Kavna, and I'm testifying today in support of LD 582. For the majority of my career, I have worked on or with an ACT team and currently serve as the manager of ACT services at Tri-County Mental Health Services in Lewiston. It has been one of the most fulfilling parts of my career, but over the years, our ability to ensure that this evidence-based service meets all fidelity and contract requirements has been more difficult than ever. I had the chance recently to sit down with our administrative support person for our team to review our billing procedures. After sitting with her for almost 2 hours, it dawned on me how labor-intensive this process had become under the per diem model. Our admin support person has to go into our billing system every single day just to keep on top of this. If she did not do this every day, this process would take her at least 3 to 5 business days to complete, full business days, with no interruptions, not being able to support our team with things like calls, documentation, participating in our daily team meeting, and much more. She did tell me that the billing under the model for the per member per month in the past was never this complicated and or time consuming. In addition to the challenges with billing, we have significant challenges with hiring for the numerous positions we continue to have open. Some of our positions have been open for well over 15 months with no relief in sight. As I'm sure you're aware, we have a significant workforce problem, but the proposed bill is putting forth the ability to open our applicant pool to individuals who have licenses and or certifications that would be equally as beneficial to our team-based approach. For example, having a medical assistant on the team in addition to, or instead of an RN, a registered nurse, would be a game changer. Another example is that I have turned away numerous candidates that come with a wealth of knowledge and experience, but do not qualify for a MERT-C, even the provisional right away. The certification can take at minimum 1 to 2 years to get, either from a class and or going back to college classes that they may have already took. Lastly, as I know you are all aware, the cost of living has gone up, and the state of Maine has done a wonderful job at instituting higher minimum wages to ensure that everyone can afford a wage that they can live on. Unfortunately, though, while those things have gone up, our rates have not increased in over a decade. As a result, being able to offer competitive wages in the field has become more difficult. The work that we do is hard and intensive. It takes a special kind of person to work for an ACT team for a number of reasons. The dual role of being a case manager as well as, say, a clinician or a substance use counselor is a challenge in and of itself. Add on to that the population we serve and the challenges they are often met with, limited community resources and intensity of the service we provide, you can see why at times it can be difficult to find the right person for the position. The ability to have funding to pay our providers what they are worth would be helpful immensely in ensuring that we have this support for our consumers. I know my time is limited, so thank you for hearing me, and I appreciate your support for this bill.
Thank you for being here. Questions for Ms. Kavna? Seeing none, we would welcome Jean Gore.
Good afternoon, Senator Claxton, Representative Myers, and other distinguished members of the Health and Human Services Committee. My name is Jean Gore. I'm a resident of Shapley, the mom of a young man who suffers from schizoaffective disorder. I'm also the coordinator for the National Shattering Silence Coalition, known as NSSC. Our mission is to speak out and inspire change for those suffering from serious brain illnesses. From a personal perspective, I can tell you that until my son was enrolled in the PTP program in 2013, he suffered many years with the kind of torture none of us would ever think was possible to survive. He thought a worm was invading his body. He thought Jesus was telling him to kill his brother. Somewhere in his heart of hearts, thankfully, he recognized this to be wrong. I witnessed him literally attempting to pull the hair out of his head, just wanting the bad demons to leave. He was hospitalized 43 times, jailed twice, missing. Can you just imagine the horror of not being able to find your child? Beaten up by 7 police officers in Burlington, Vermont. He was homeless in Burlington, Vermont 1 year, and I kept driving there every weekend to attempt to engage him somehow into treatment. He thought I was a hooker who wanted to have sex with him. He no longer recognized me as his mom. Imagine how devastating that was for both of us. In 2013, once we were able to get him in the PTP program, the suffering for the most part finally ended for him. All those years, we were unable to get successful treatment, however, killed brain cells, making my son unable to achieve his maximum ability to become a contributing member of society, and more importantly, achieve his dream to become a recognized musician and artist. He and I both now suffer from PTSD, anxiety, etc., in addition to his schizoaffective disorder and anosognosia. Below, I'm providing links to studies, etc., proving the success of ACT teams, both in economic terms and in terms of how effective they are at helping those who are most seriously ill to achieve stability and a meaningful life. I know this is a trying time and your budget dollars are stretched thin. If we truly want to find our way out of this, we can no longer ignore our most vulnerable citizens, those with serious brain illnesses commonly referred to as serious mental illness. By ignoring them, not only is the human cost high in terms of suffering, loss of life, etc., the economic costs are catastrophic. At NSSC, we call it the cost of not caring.
30 seconds.
One more note, as I witnessed back in 2012, before we could actually get the PTP program for my son, the services of an ACT team alone, although they were tremendously helpful, did not provide all that was needed. The combination of an ACT team and assisted outpatient treatment would give those with schizophrenia or bipolar also suffering from anosognosia the best chance for true recovery. I've provided more links in my written testimony. Thank you so much for hearing me, and I sincerely hope you will support the passage of this bill. Our children deserve every chance at a happy, successful life, and so do their parents. Thank you, and I'd be happy to take any questions.
Thank you, Ms. Gore, and thank you for sharing your story and that of your son. Any questions from the committee? Seeing no hands up, we'll turn to Betsy Sweet. Betsy. Betsy Sweet. There she is.
Sorry.
That's quite all right.
Sorry.
Welcome.
I'm Betsy Sweet, still from the Behavioral Health Community Collaborative, and there's a theme developing. And this is, again, one of the services that is desperately underfunded. And, the one thing that I want to just emphasize on this, and there's other people who will speak to it, but I think the challenge for the committee and for the legislature is to figure out what to do in the short term, because all of these services are desperately underfunded. The pandemic exacerbated the need as well as inhibited the ability of agencies and organizations to be able to meet these needs. And so it's just been really, really important to make sure that we figure out what to do in the short term. And I look forward to helping you and trying to make sure that this works. And this is, again, a model service. This is a model service that, if it worked correctly, is awesome. Team of people helping people. This is how it should work. And in the beginning, it worked really, really well. And we just need to make sure that we have the services in place. I mean, it's very, very challenging to find a psychiatrist in Maine, or even a nurse psychiatrist in Maine. It's very challenging to find any of the people that are required to be on these teams and have them be there. So again, I look forward to working with you and figuring out how we deal with this in both the short term and the long term. Thank you.
Thank you, Betsy. Questions for Betsy? Seeing none, Mr. Pickering, would you like to unmute yourself and speak with the committee?
Okay, there I go.
There you go.
Thank you so much. I don't have a success story to tell. I have a hope that Maine will stop putting people with brain disorders and addictions into jails and to their deaths by unfortunate laws that are so rigid and policies that are so wrong, including the policy of, I really believe, I've been director of community health organization for 30 years, and that we put together the first ACT team in the state with Senator John Nutting, and it was so ironic that my son Chris would later, many years later, become a client of the agency, and it was successful, and unfortunately, due to the amount of time allotted, even though I was director, he transitioned into other areas of programs, and then later, unfortunately, the situation got worse and worse and worse, and Chris died. And what I would like to say is that we need to really, the state really needs to be serious about stop labeling our illness as mental illness and physical illness. How we define the illness will determine the level of funding and whether the service exists or not. And what I would like to see is, I would love to see LD 582, LD 196, LD 1147 funded, because if we continue on the path that the Maine has been on for a long, long time, we're going to spend our money in jails and spending our money, with terrible situations that we don't need to face. We should be fully funding these organizations. I just want to read you one quick thing to wipe away your minds of mental illness, of behavioral health, of physical health, physical illness. What is schizophrenia? This was a reporter of the New York Times put it this way: schizophrenia seems to be not a single disease, but the endpoint of 10,000 different disruptions to the delicate architecture of the human brain.
30 seconds, Joe.
Okay, and I just hope your committee and the state could be supporting these various bills and recognize that you're doing the right thing instead of the wrong thing. Thank you very much.
Thank you. Thank you for that testimony. Questions for Mr. Pickering? Seeing none, we'd welcome the Honorable John Nutting. John.
Can you hear me?
We can.
Okay, great. Still John Nutting from Leeds. I'm still Senator Claxton and Representative Meyer and other distinguished members of the Health and Human Services Committee. I'm still proud to have been the sponsor and the author of the Progressive Treatment Plan law that passed in 2005 and the Assisted Outpatient Treatment law that passed in 2010. Again, research after research has shown that a majority of our mentally ill that are in our jails and in our hospitals, some being in hospital 20, 30, 40 times a piece from continually stopping their treatment plan, suffer from the anosognosia, a lack of awareness of their illness. And it has been so gratifying to talk to dozens of parents in Maine whose loved ones for the first time have had successes under the PTP program because they're working with ACT teams. That has been the premier thing and reading from my PTP bill, just a couple sentences, but it talks about ACT teams are the ones that are providing treatment, rehab, and support services to persons with mental illness for whom other community-based treatment approaches have been unsuccessful. It is kind of the most effective thing in order to keep people and letting them have some of their first successes that they've had in their lives, and keeping them out of our jails and out of our hospitals. I serve on the Human Rights Committee for Riverview Hospital, and things are going much better there. But we've recently, in the last 18 months, released several people out of Riverview into the community because that was what was appropriate. But we are actually having to provide ACT services to them in the community from within the hospital. That's how short and weaker than they used to be local ACT teams are. And so, as far as treating people humanely, as far as saving the state millions and millions of dollars on jail and hospital costs, ACT team is really the best way to go, where 8 or 9 people on a rotating basis can keep 50 to 70 people in the community, people that have continually been in hospitals and jails previously to that. So it's been, as I said, over 10 years since they've had a rate change. To me, that is long overdue to treat people humanely and to frankly save money. And again, thanks for listening.
Thanks for being here. Questions from the committee for Mr. Nutting? Seeing none, we welcome Katie Fulham Harris. Katie.
Thank you so much, Senator Claxton, Representative Meyer, members of the committee. I am Katie Fulham Harris with Maine Health. And we have determined that because there are so many rate bills before you to address the massive crisis we have in the community mental health system, the testimony that I submitted is a single statement that reflects our position on all of these rate bills put together, rather than testifying on each one. Just to give you some idea, Maine Behavioral Health Care is budgeted to lose $5 million on its community-based services this year, $895,000 of which is from ACT services, which we know are so vitally important to keep people who have high levels of need out of the hospitals, out of the jails. So it's not really a wonder that services are crumbling around us in our communities. The impact of the chronic underfunding is creating serious levels of need. And I would add to that on any given day, Maine Health hospitals have about 25 patients awaiting behavioral health care beds in their hospital emergency departments. And if we invested in the planning and the rebuilding of the community-based system, that number would diminish dramatically. And I would add that we believe these bills should go hand in hand with LD 118, which is the Children's Behavioral Health Bill, and LD 1292, which is the Senator Breen's Strategic Planning Bill. We need to do, as Betsy Sweet said, short-term fixes and long-term planning and investment in the development of a truly comprehensive behavioral health system to meet the needs of people with mental illness and substance use treatment. Just this morning in the HCIFS committee, Representative Zager had a bill in which a large number of family practice physicians testified on. Nearly every one of them focused on the access to behavioral health services, because there really is a dramatic crisis going on, particularly with a pandemic. So with that, we will not bug you with at every single hearing related to these services. You have our statement. You know that we strongly, strongly believe that this has to be addressed, and it has to be addressed not in the silos of each individual bill, but collaboratively and collectively to ensure that we have a continuum of services to meet the needs of our patients. And I'd be happy to answer any questions.
Thank you, Katie. Yes, Representative Craven.
Thank you very much, Madam Chair. And we've had an extraordinary day here, and I've learned a lot. And I agree with just everybody that came here today. But I would ask something of providers, and that is that my inbox is really getting full of emails that tells me not to raise any taxes. And it seems to me that people want services and worry about how to pay for them. And I've made this speech before, and it's kind of embarrassing, but we have to get the money somewhere. And I think as a politician, I'm not going to be the most favored person to say that I'm going to raise taxes, because that's going to be the end of me. But I would ask people who have such a great interest in these services that we need and that we have to have. And I have a child with a mental health need as well. So I know where you're coming from. I would ask people to write op-ed pieces and let the community know that this is where we are. This is where we are. And that you know, the amount of taxes that would be added to anything would be minimal to earn enough money to be able to pay for those. So thank you.
Thank you.
Senator Moore.
Yes, thank you, Representative Meyer. Katie, what were those two LD numbers that you mentioned in your testimony?
Representative McCrate's LD 118, which is the bill to address kids who are stuck in the EDs that would require the development of a plan. And really the reason kids are getting stuck in the EDs is because of a lack of services across the continuum. It's not just inpatient services or residential, it's the continuum. And then LD 1262, which is Senator Breen's bill to create a strategic plan for behavioral health services.
Thank you. I couldn't write it fast enough. Thanks, Katie.
And it's in my testimony as well.
Seeing no other hands up, thank you, Katie, for being here today.
Thank you.
Finally, Mallory Shaughnessy. Welcome, Mallory.
Good afternoon, and thank you so much for your perseverance, all of you, for this very long day. Good afternoon, Senator Claxton, Representative Myers, members of the Standing Committee on Health and Human Services. I am still Mallory Shaughnessy with the Alliance for Addiction and Mental Health Services, and we are very thankful to Representative Madigan for bringing this forward. I'm not going to read all of my testimony either. I've submitted it. There's a lot of additional information that I submitted with my testimony. But the bottom line is we were here 2 years ago with you saying these very same things. We passed a bill through this committee, LD 1135. It was majority voted through the House and Senate, landed on the appropriations table, and ended up dying when everything shut down for the pandemic. We're still here. It's 2 years later since we first put that other bill in. And, you know, we talk about, the one thing I will highlight is the department has stated there needs to be methodology. But if you take the dollar and see the average inflation of 1.92% per year since 2005 to today, when the last rate increase was for this, you come to 35.63% increase. We're asking for 25%. And there's a lot of pieces in the bill that are not just about a rate increase, but in trying to get the ACT services to adhere more closely to the fidelity of the model. And I highlighted several of those sections in there. I'd be happy to answer any questions about those. So it's beyond just the rate increase, which is needed. In fact, one of our members just told me that they had 4 referrals to ACT teams and had to tell them that it would be a 4-month wait to get somebody in. And some agencies have almost a 6-month wait. So it's a dire situation. You know, you can take a look at my testimony, the additional information that I put in there. One of the things I would talk to as this conversation sort of shifted to how do we pay for this, there is a coalition of groups like ours and like others that stand for the needed services in the community that are coming together to talk about tax fairness and to say that we have some loopholes that could be closed up, that there are some ways to provide additional funding so we can pay for these. And the bottom line is you're going to save money. I know we can't do dynamic forecasting in our budgets, but if money gets invested in these front end pieces to keep people out of the jails and the prisons and the emergency rooms and cycling through like they do, which is harmful and expensive. So with that, I would leave it, and please look to this one. I will give you a couple of other key pieces. Children's mental health, this one, there's a couple of key things that have got to be addressed now, or we're going to lose more of them. We've just had 2 ACT teams close down in Portland. They're closing. And thank you. Be happy to get you more information or answer any questions.
Thank you, Mallory. Questions for Mallory Shaughnessy? Seeing none, thanks once again for being here.
Thank you.
I don't see anyone else in the queue to provide testimony, so I will ask the committee if they've got any requests. Yes, Representative Perry.
Yes, I think, and I don't know if there's a way to find this out, but how many mental health programs or agencies have closed down over the last 10 years?
Anyone else? See no hands up. With that, I would close the public hearing on 582. That concludes our work for today. I want to thank the committee for a long day of hard work. It's much appreciated. Is there anything else? Erin shut down her window, so I'm assuming that's all we've got. The committee Democrats will caucus at 4:30, tomorrow's work sessions. And I would entertain a motion to adjourn.
So moved.
Second.
Seconded. All in favor? See you soon.